result, but because we are human beings and we decide to use our own knowledge by ourselves, we got some things right, or we are getting some things right. So not to waste your time and not to sound like a broken record, let me run you through what our timetable or our schedule will be like today. So we'll be having our first session after my intro and everything. We're having our first session from a fantastic person whom I will not mention his name now. I'll wait till when it is time to bring him on so that you can hear the kind of person we have brought to you to discuss this very important issue. Because you see, the issue of parenting is not something that should be taken lightly. You know, when we were growing up, we used to say, when a child does something wrong and is in the community, you know, whether your father or your mother, so far that person is in the community, he or she has the right to correct you. But these days, Yoruba said, "Ba mi no mo, mi ko denu olomo," meaning, I will translate that literally, help me beat my child in not reach the inside of the person. That means that correct, spank, guide my child for me does not necessarily, it's not necessarily coming from within. I'm not too happy with you beating my child for me. Why should you beat my child? Is he your child? Is he your child? Why should you beat my child? You have your children, beat your children, guide your children, leave my own to me. That is the era we are in now. But here we are going to discuss what can we do? How can we work together to make it better in relation to mental health? In relation to mental health. Remember earlier I was talking about in relation to mental health, and it's so funny that there's this body language when I do this. I believe a lot of you would ascribe it to something, but don't worry. After today, I'm sure we'll stop doing this. I will stop ascribing it. So we are going to have our first session with Dr. Aroyemo. That will be our first session. After his session, we'll have a question and answer. Then we'll have a recap. Then after that, we'll move to our second session from someone after my heart. And I'll tell you why she's after my heart when we get to that session. We'll be speaking with Zurel Olowe. I need to get the pronunciation correct. Is it Olowe or Olowe? I'm sure when we get to that session, she's going to tell us the correct pronunciation. After that, we'll have the Q&A. Then we'll have a recap again and go to the third session with Mrs. O. What does O stand for? In case you do not know. Sit back, relax, you soon get to know. We'll be discussing germane issues. Then we'll look at the news and upcoming events from Brainy Educare. And after that, we are going to close. So, having said this, do I have your permission to move swiftly to the first session? Yes. Do I have your permission to move swiftly to the first session? You can either give me a response via the chat or just say yes. Because you see, my own constituency, I do not spend budgetary allocation without getting vetting from the constituent members. So do I have your permission to move ahead? Okay, fine, thank you. Wonderful, wonderful, wonderful. Thank you very much. I can get responses. Thank you so much. So we are going to be moving on to the next session, which is going to be few minutes. And when I say few minutes, I mean few minutes with one of Nigeria's best professional in the area of mental health. Now, the issue of mental health, a lot of people assume that mental health is when someone is crazy. But recently I've come to understand that mental health is not just about being crazy, and it doesn't necessarily mean that you are crazy, but it's telling us the health, the position of you as a person and your mental state. Just like when we are ill, we have malaria, we have typhoid, we go to the hospital to check our mental situation. So also is what we mean when we talk about mental health. So please, I'm going to be inviting someone who is the National Vice President of the Psychological Association of Nigeria. He's a renowned clinical psychologist. He has worked for many years as a professional in the mental health space. For over 10 years, he was the lead clinical psychologist at the Federal Neuropsychiatric Hospital, Abeokuta. No, sorry, beg your pardon. Federal Neuropsychiatric Hospital, where's that? Uselu, Benin City. Was also a pioneer lecturer at the Faculty of Social Science at Chrisland University, Abeokuta. Currently, he is a senior lecturer at the Department of Psychology, University of Lagos. He is also a member of the Nigerian Association of the Clinical Path Psychologists. Please join me to welcome our first lecturer, Dr. Afolabi Aroyehun. Dr. Afolabi Aroyehun, you have 30 to 35 minutes to discuss, tell us, open our minds, inform us, and make us better aware. Please, could you either clap normally or use the virtual clap to bring on Dr. Aroyehun? You have the floor, sir. Dr. Aroyehun, we can't hear you. Operator, do you have to unmute him? We can't hear Dr. Aroyehun yet. I can see he's speaking, but we can't hear.
Yeah. Thank
you. Okay, great. We can hear you now.
Yeah.
Go ahead, sir.
Good morning, everybody.
Good morning.
Good morning. My name is Dr. Aroyehun Afolabi, and I am a chartered and licensed clinical psychologist. And all my life, this is what I've been doing. I practice and I teach. Just a bit of correction. I was the National Secretary, Nigerian Association of Clinical Psychologists between 2008 to 2013, and I became the National Vice President since 2013, and I stepped down in 2017. Now, currently, with Chrisland University, I'm one of the pioneer lecturer, and I left Chrisland University as the acting dean, Faculty of Art, Management, and Social Science before I moved to University of Lagos, where I currently teach. And currently, I'm a senior lecturer there. This morning, I will be talking on mental health issues in children. And oftentimes when people talk about mental health, like the anchor said, we look at people who are probably vagrants on the street. And that is the picture that we have of mental health. But unknown to us, there are a lot of people who have mental health issues. They are not vagrant. They live with us, they work with us, they interact with us in all spaces, offices, homes, and all that. But we do not see them probably because they are still in the offices. They have not broken down, and we see them as people who are still lucid, in quotes. However, for the purpose of today's lecture, I would just like to throw more light in that direction for us to know what mental health is. Also, when we talk about mental health, many people believe that mental health issues or challenges can only be with the adults or the elderly. Unknown to many, children also have mental health issues. And as a matter of fact, I will say this maybe as a general rule. When you look at your child, and it appears to you as if there is something confusing about you, about the child to you. He seems to have some things that is not in line with other children, or probably there are some behavioral attributes and characteristics that does not go in the way of other children, then we need to suspect mental health issues. There could be other physical issues that will manifest, or there are physical issues that the children may also have that can precipitate mental health challenges. However, the bottom line here is when you see any behavior in your child or any act in your child that to you cannot really place your finger on it in terms of whether it's normal, you doubt its normality, then you need to start talking about mental health issues. Mental health is a state of being normal, while mental illness is a state of mental unwellness, which is characterized by different symptoms. And the symptom manifestation in adults and children, they may in some times similar, but most often the criteria or the symptom in children are not exactly the same way with adults. Now, let me start this way. There is what we call, for you to say somebody is having mental health issues in children or in adults, there are some basic things we need to watch out for. And those are the things that I want us to look at. How do you categorize abnormal behavior? Or what gives you the impression that something is wrong with this child? That is what I want us to look at first. There is what we call generally, for the purpose of this class, to make it easier to understand, we call it the 4Ds. The number 1D is deviant behavior. Looking at your child, what kind of pattern of behavior do you observe in your child? Are you seeing a behavior that is out of the norm of the society? A behavior that, when you look at it and compare to what you see around you, seems not to be in keeping, then it may be a deviant behavior. Why is it that often your child intentionally decides to be against the law, against the rule, against the norm of the home, against the norm of the society? When you see that, it might probably be because the child is having a deviant trait, which generally we call deviant behavior. A typical example is, which I normally use in most settings, every child, when they get to church, they sing, they dance, they laugh. Even for adults, it's a normal thing. Clapping and singing and dancing in the church is a normal thing. But when you now see such individual walking into the library and still saying, praise the Lord, shouting and singing the Lord, then something is wrong, even after repeated caution. When you see some things happen in the house, do not do this again. You gave your instruction, the rules, this is it. And oftentimes that child keep breaking that rule intention without any recourse. Then it might be that the child is having issue with deviant behavior. The second thing, generally, if you want to talk about it because it's a child, in mental health setting, we'll say probably the child is having conduct disorders. And it becomes a disorder. Let me clarify that. A child may be having a difficulty. It may not go ahead to be, you may not be able to, it may not qualify you to define it as a disorder. It is not a disorder if it is not affecting, it's not making the child to be dysfunctional, then it's not a disorder. But if what the behavior you see is making the child to be dysfunctional, he could not do anything that he normally supposed to do, it's impeding his ability to function in different settings, then you say it's a disorder. So when you see a child that is having deviant behavior, often and repeatedly, it's likely to be that the child is having a conduct disorder. Let's look at another issue. I want to talk about the dangerous behavior. That's another thing that we see. Please, I want to know if you can hear me. Can somebody give me a sign or say something to know whether you can hear me?
Yes, sir.
We can hear you loud and clear, sir.
Okay. Now, the other thing I want us to talk about is the area of dangerous behavior. These are behavior that happen in the house. Repeatedly, you see your child in getting involved in risky behaviors, behavior that can be danger to self and danger to the others around him. When you see a child that repeatedly, all he wants to do are activity that will bring problem, that is so dangerous that if you leave that child unchecked or someone is not there with the child, then that child may eventually harm himself or harm others. Then you classify it as a dangerous behavior. And when you see continuously see dangerous behavior in children repeatedly, then it calls for attention. As most of the number of children having attention deficit hyperactivity disorder are in this category. You just see them doing jumping, climbing, and all that. When you see it, you need to watch out. That child may be having a behavior that needs attention, and you can't leave that child like that. Some people will say, hey, he's a child, he's energetic, is this, is that. Yes, every child is energetic. They want to run around, they have enough energy to run, but not in getting involved in repeated dangerous activities. When you see that, then you need to watch out. It might be that the child is having a behavior that needs attention. The next one I want to talk about is this issue of dysfunctional behavior. It refers to impairments generally in the child. And this impairment that we are talking about, it impedes the ability of that child to cope with what is in his surroundings. It cannot function the way other children are functioning because of this impairment. It could not carry out his daily activity, whether in school or at home. And his behavior, that impairment that you observe is above what is normally seen in other children. So when you see that, then you need to know that something is going on. For instance, somebody may be having impairment in cognitive impairment that is affecting the child not to be able to perform well academically. Not that the child does not want to go to school, not that he didn't want to function, not that he didn't want to read, not that he didn't want to write. The child is making effort, but there is this impairment in this child that is limiting his ability to progress, limiting his ability to function. Then that is another thing that you need to watch out for. We call it dysfunctional behavior, a behavior that is making them not to be able to function. And oftentimes, it's self-limiting. It limits the ability to get to a particular level. They may not be able to progress beyond their peers or even perform at the level of their peers. That is the dysfunctional behavior. Now, you see that in different fora. When you see that in a child, it can be in form of cognitive, it can be emotional, and it can be even in behavior as well. Self-limit it may be in form of not having the ability to do some certain things that others are doing, or emotional state that is lowering the ability to function, or a cognitive state that is lowering the ability to function. The next one I want to talk about is distressful behavior, a behavior that is causing distress to the child. It may be in form of experience of emotional experience or pain that is making that child not to be able to fulfill the roles that is before the child. We all know that stress is a common phenomenon in life, and sometimes the level of stress became so great that an individual find it difficult to function as a result of it. Fatigue, anxiety, depression, and all that can be found there as well. So having said this, I want us to take it one after the other. I mean, maybe I should take intellectual impairment or impairment in cognition generally, because we're talking about children. And oftentimes we look at our children. All of us have turned to parents now that is consistently looking for increased numbers in their academic performance. The way we raise children now is go to school and get the best result for me. How you get it, I don't want to know. But what I will do is I will give you lesson teacher, I will give you school teacher, I will give you this teacher, I will give you that teacher, I will give you this teacher. And you make all those things available. And at the end of the day, the only task that we set before the children is for the child to do well, or to increase the numbers or his performance academically in school. Much as that has a problem for the child, because that makes most of these children not to be able to relate with their parents better now. Majority of them, we have turned majority of time, we have turned these children to children whose only focus should be in academics and should not have any social interaction with parents, with siblings, with the environment and all that. All we want is go to school and get good grades and good figures for me. If you want to buy a toy for them, we give them toys that talks about academics. Games that talks about academics. Anything you want to give them is things that talks about academics. Even the shows that you allow them to watch on the television and all that, it is educational. That is an issue on its own, but that's not what we are here to discuss today, because children that are raised like that, they tend to have to be cut off from family responsibility, from family relationship, from social relationship, and how to cope. They cannot really find their location in the family. It's like they are part of the family, but they are segregated from the family. And that's why it appears that some of them, when it's time for them to take emotional decisions they will take is only a decision that will favor them. They find it difficult to consider the next person. Family interest is not taken into consideration at that point. What is interesting, because all you have taught them is go there, get the best grade for me. It doesn't matter how you do it. And that affects their relationship with their siblings at home, affect their relationship with their parents at home, and affect them, their conduct outside the home. But that's not where we're going today. I want us to to discuss the issue of intellectual impairment. Intellectual disability generally, I will talk about it in two ways. The first way I'm going to talk about it is as a disability. It's a common thing that we find in our society. It is preventable. And I think it poses a very huge burden on the society. And as a result of that, a lot of them developing and underdeveloped and developing nations have a sizable number of these people. Because of the kind of environment they found themselves, it poses a lot of burden on the parents and even the children, because in school they are stigmatized. At home, we look at them as this one alone. This is the way he behaves and all that. And these children that we're talking about, they want to perform. You provide everything, school teacher, lesson teacher, everything, you gave it to them. They are there listening to the teacher. The teacher interacted with them, they do everything. But at the end of the day, they are not able to bring in good grades back home. Oftentimes, as parents, we beat them. Because I know in my own generation, they will beat you. You might likely forget your name because of the beating that you failed in school or you didn't do well in school. Nowadays, that you can't really beat them. The only thing you do is to say, I will deny you of this, I will deny you of this, which in itself is another problem. But the question is, why are these children not performing well? Is it that they intentionally do not want to perform well? No. Is it that they are not putting interest? No. Is it that they just want to waste the parents' money? No. But there is something within them that is limiting their ability to perform cognitively and in class and in the general setting. So what is this thing called? Generally, if you want to, this intellectual impairment is a condition of arrested incomplete development. These people we are talking about, there is a level in their development that is incomplete. And this state of arrested incomplete development that we are talking about, is in the mind of the child. And apart from using IQ to assess it, the child must also have incomplete development or difficulty in at least two other areas of their ability. It might be in communication, it might be in interaction, it might be in self-care. So when you see this kind of children, you realize that oftentimes it's not only in academics that they are not able to perform. You will see it in their ability to communicate. Many of them have a problem with communication initially, but eventually they develop to outgrow it. And many of them may not understand, may not achieve enough language for everyday activity for the rest of their life. They will get some language to get to just barely get around, but to be able to achieve language to their own level, to their age, and the level of understanding and the way they are expected to relate, they may not be able to get enough language to do that. Some of them have issues with their taking care of themselves. They may not be, some may not be able to wear their clothes, may not be able to bathe themselves, may not be able to do this. All this, we will look at it in the course of our discussion. And when you see this, you realize that it's a very high burden on the caregiver, and the treatment is something that is manageable. It's a condition that is manageable, and the state can be improved with available educational intervention and all that. But oftentimes, many of the parents never knew that this is a form of mental health issue. So who are these people? They have IQ that is less than 70 on a standard IQ test, and they have impairment in at least 2 areas of their adaptive functioning, either communication or social interaction or self-help and all that, or community living and whatsoever. Now, there are basically 4 types of them. We have the mild one, which is, they say IQ of 50, between 50 and 69. These people, they are called mild. When you say somebody is having mild intellectual disability, this person can go to school. He will go to school, but his progress in school will not go beyond primary 6 or GSS 3. No matter how you do it, with assistance, with this, they can get to GSS 3, but they may not be able to progress beyond that. Many of them will even drop out before by primary 6. They won't be able to. For the moderate IQ, on a standard IQ, they should have an IQ of between 35 and 49. These people, they are next to the first group that I mentioned, and they will be able to go to school, but many of them may not be able to perform to go beyond primary 3, between primary 6, 3 and primary. So a lot of assistance that you are giving, maybe by the home teaching and all that, that would be one. But majority of them may not be able to go beyond primary 3, between primary 3 and primary 6. Now, don't forget, I want you to mark some of the things I'm saying. For mild, it's IQ of 50 to 69, but they may not be able to go to school beyond to primary 6 and GSS 3. Why the moderate, their IQ is between 35 and 49. They will go to school, they will perform well initially, but their performance may not go beyond between primary 3 and primary 6. In addition to that, you may have some other issues with them. For moderate, language issue, you will see some significant issues in their communication. For mild, their communication can pick up effectively eventually later, and they can achieve independence in communication. But for moderate, you will see gaps in their communication, and their level of communication will be limited to their level of performance in school and all that. For severe, their IQ is between 20 and 34. For this group of people, many of them, they will be able to, if you put them in school, majority of them may not be able to go beyond primary 1 and primary 3. Even that primary 1, primary 3, they will repeat severally, but at the end of the day, their actual performance may not go beyond this primary 3 that we're talking about. That's where they will be stuck. And for the rest of their life, the major thing that you can train them is in the area of self-help, self-care, how to take care of themselves and all that. Many of them may not be able to attain bowel and bladder control. It's very sizable amount of them, maybe, but for the rest of their life, what you'll be teaching them will be issue of how to take care of them. And the last group, which is the profound, the IQ is from 0 to 20. But this group and severe, the two of them have a lot of comorbid disorder along the same line. So, because oftentimes I see people turn out in my office, they will bring results of IQ tests. They say my child is mild. What does mild translate to? I don't know, there is no time I want to go to other things, but let me just quickly say this. With the way I classify them and their performance in school, you should have an understanding of the fact that some of them may not be able to go through school because like profound, if you put them in school, they can't even perform beyond primary one. They can't even perform in primary one because many of them cannot take care of themselves. They don't have bowel and bladder control and all these. Everything about them is dependent. They are dependent on people for the rest of their life. The same thing goes with severe. For moderate and mild, they can perform some level of independence over some period of time. Why I said this intellectual disability is in two ways. I will talk about the disability side, and I want to talk about the genius side, the side that they are highly intelligent and highly cerebral and intellectual. They are very good academically. They are sound. The exam or no exam, they are doing well. All the grades, they are cutting it, and they also need attention because they fall in the group that is called the special children. Their education is different from others. The way they interact in their interaction, their education, their emotion, and every other thing about them is different. So they are a group that you cannot compare with the children in the general population because if you do that, then you will not be doing justice to other children. So what I'm saying here is both a child that is highly, that have very high IQ that you generally refers to as a genius, and those that have intellectual disability that people classify generally as mentally retarded. The two of them are special children. They need special attention, they need special, because the two of them are not functioning at the average level of every child in that society. The first group, they are functioning above every other child in the society, while the second group, they are functioning below every other child in the society. So when you encounter them, they need attention. And that's the essence of saying what I'm saying now. Now, I don't know whether if you can see my slide, some of the things I mentioned is on my slide, so you can get it from there. The issue of speech, emotion, perception, and others, they are also affected, and you can get to other things there. Now, I want to talk about one other disorder before my time is off. Let me quickly talk about this because there are some children, they are not having they are not having outright intellectual disability, but they are having learning disorder. Some people, their learning disorder is in reading. They have reading disorder, which is called dyslexia. Some have mathematical disorder, which is called dyscalculia, while some have writing disorder, dysgraphia. They may be good, but those that are having dysgraphia, that's writing disorder, they may be good academically, but writing is a problem for them. They may not be able to write and all that. While we also have people that have spelling problem as well. Some have spelling problem among them. The mathematical disorder, some of them, they may be good in every other area, but when it comes to calculation, it's a no-go area for them. They may not do well in that area at all. And the last group is the one that is called dyslexia. They have problem in reading and whatsoever. So in that group now, I have given us about 5 categories. Apart from the 4 categories in mental retardation, I gave 1 for the genius, and now I've given you 3 for the other group that may be normal children with normal IQ, but they have issues in specific area. So when we encounter that in our child, let's not say because it's a problem and they want to do everything to make it. It's not their fault, but there are educational intervention that can help them. The motor skill disorders, I don't want to, this is not there are people that have this, but it's not a major issue because they have problem in coordinating their movement. Development of motor coordination is a major problem for them. And you see that students with the cerebral palsy have that in a large portion. We also have communication disorders, which is inability to express one in language. Some people can express themselves, but the language development is not up to their age. We also have that as well. It's also a mental health issue. Stuttering is another issue. When children stammer, like you call it generally, it's also another issue I want us to pay attention to, because oftentimes we say, the father also have it. Some people say when he's angry, he will start stammering and all that. It is a mental health challenge, and but it can be helped. It's not something that is actually out of hope. There is intervention that can make us that can ameliorate this as well. Pervasive developmental disorder is another one, but that's not where I want to just talk about two things. I've talked about intellectual impairment. Autistic spectrum disorder is, yes?
Sir, kindly look at your chart, sir. Thank you.
Okay. Yeah, are we together, please?
Yes, we are together.
Yeah, I guess I'm too fast, but because when you want to talk about mental health in children, there are a lot of things that we have to say there, but I don't know how I can break it down. But let me just talk generally and come back to allow people to ask questions so that I'll be able to respond to it properly. Okay, I think my time is up. But before I round up, let me mention two things. One, I want to talk about conduct disorder, because some of you see your children behaving abnormally that is not in keeping. Some of them run away from home, come back, and all that. Substance use is also there. But I intentionally focus on intellectual disability because majority of the children that are having this problem, some of our parents ascribe it to spiritual reasons or to one other things and other. A lot of children are going through this, and the parents do not know how to handle it. My message is that there is hope. Please, let's pay attention to them. Once you see them, consult those that needed to be seen. So let me pause here so that I can take your questions and I will be able to answer them appropriately. Thank you.
Thank you very much, sir. Thank you so much. Can I get a round of applause for Dr. Aroye? Virtual round of applause. Thank you so much, sir. Fantastic. So, you have said quite a number of things. I apologize for the mix-up in the beginning, and I'm happy that you're able to set it straight. And I like the fact when you mentioned that you're a chartered clinical psychologist. Chartered. In capital C. Also, you left as acting dean, Faculty of Arts, and now presently you're with University of Lagos. Thank you so much for that. You touched on the area of mental health issues in children. I can see your questions. We'll get to that in a bit. Quickly, you said that when you can't place a finger on the normality of the behavior of a child, then we need to check the mental health of that child. Very profound. Also, you told us you categorize abnormal behavior into 4. You gave us the deviant behavior, the dysfunctional behavior, the distressful behavior. So, am I correct, sir?
Yes.
Which was the last one? I didn't get that.
Dysfunctional.
Okay, deviant, dysfunctional, distressful.
Dangerous.
Dangerous. Yes, that's the one I didn't get. Dangerous behavior. You also told us that when we send our kids to school now, our focus is just go there and blast and bring all the A's. We are not concerned about the other things that happen. We are focused on academic. Sometimes these children come out, they be part of the family, but they are also not part of the family. They are part but segregated in a way. You told us about intellectual impairment, a condition which is an incomplete development of a level of an ability. You told us about the different areas of intellectual impairment, the normal children who they are mild, where their IQ is between 50 to 60. And it's very interesting to understand that those kind of children cannot go beyond GSS3, between primary 6 to GS3. You told us about the moderate who cannot go beyond primary 6. Their IQ is between 44 to 50. You talked about the severe and the profound. You also talked about dysgraphia, dyscalculia, dyslexia. These names are very interesting to the ear, and when we know their meaning, it also helps us. So will I be right to mention that some people during the NDCC probe are discorruption? In case, in case.
That's your own coinage anyway. It is allowed.
All right, sir. So let's go to the questions of our listeners. So KLA. Okay, 1 minute. Let me be able to get those questions. Okay, so KLA says, can behavioral challenge be categorized as mental health disorder? Can you briefly respond to that, sir? Behavioral challenge, can it be categorized as mental health disorder?
That's why I made the clarification with the 4 Ds. What you are calling a D, a challenge, can it be found within the 4 categories of the If you can find the disorder in it, then it is a mental health issue that needs attention.
Okay, great. KLA, I believe that is taken. The next question from Karima Jagun says, please, can we get the slides and recording of the program? I believe the organizers would attend to that. So Azizat Gidigbi, I'm sorry if I didn't pronounce that correctly, but Aziza says, I have a child who is brighter and more intelligent than his peers. I'm feeling incapacitated on how to assist him and challenge him. He's a voluptuous reader. He's just 8, but reads not limited to academic literature like a teenager or older. What advice do you have for her, sir?
Well, that child is to get assessment for as an exceptional child. If they assess him and qualify as an exceptional child, allowing such child to go to regular school, you are doing a lot of disadvantage and disservice to that child.
So that kind of child should not go to a regular school?
They do not go to a regular school.
Go to special school.
Yes, they have their own school separately. However, even if you don't have the option or anywhere to take them to, if there is in regular school, there are educational their IEP will be different, individualized, personalized educational program.
Curriculum. Okay.
Yes, it will be different from others. What they will be, the way they take them will be different, and they may not be in the same class with their peers and their mates.
Interesting. Thank you very much, sir. Just by the side, for a special child that is IQ is very high, you know, those kind of teachers that will teach those children, their IQ will not be here.
Oftentimes, those 2 kind of students are they are abused in this normal school setting.
Oh,
they are abused in the normal school setting and that's why they are not meant for the normal school setting, because their brain is processing faster than their peers. And even if the teacher is not careful, the teacher cannot keep pace with their own level of understanding. So when that
challenging the teacher.
Yes, they challenge teachers, and instead of the teacher to understand the fact that it's possible, because the teacher too may not have understanding of the fact that this child may belong to the category of exceptional children. So they turn it out in anger. They always challenge me. They always say this. They turn it out in anger, punish them unjustly, and do a lot of things. Those are the kind of children you see in timeout or room often.
Thank you for that. Okay. Kera Dosunu says, aside from academic engagement, what range of activities can parents do for children with intellectual disability?
Well, it depends on the classification that the child is. For those children that are having mild mental retardation, well, they are educable. They are educable. They can be trained in semi-skill or skilled labor, and most of them eventually, some of them on the higher level range of mild mental retardation will achieve independence in childcare, in being a wife, and in some other. Some of them will achieve independence, but those on the lower range of mild may not be able to attain that. So for such people, you can train them, let them learn a trade and all that they can do. Train in semi-skilled and unskilled labor. They will do well in it because they already have some level of education from primary 1 to anywhere the child stop, whether primary 6 or between primary 6 and GSS 3. That education is handy for them, and they can fall back on it when they need it. So that makes them to be able to get training in semi-skilled or unskilled, and they are able to perform better in it. But for the other ones, because their level of progress in school is limited, so they may not be able to perform as much as those who are in the mild category. As a matter of fact, when you see somebody that is having mild intellectual disability, they are as normal as every other child. But you will see with time, the major problem they will have is in academic reading and writing. Because even the delayed speech that they had, they will overcome it with time. But major problem is academic reading and writing. So if they learn a trade, they can do well in it.
Interesting. So what I hear you say a lot, sir, is that, like we used to say when you're trying to understand yourself, self-discovery, we say, try to understand yourself, know yourself. What I'm hearing you say now is also know your child so that you can be able to identify which training or school or care that is, right for that child. Am I correct, sir?
Yes, but in addition to that, once you see that your child is not doing well academically with all the intervention, get the child to a psychologist to assess for you so that we determine the level of impairment. Once we know the level of intellectual disability that the person is, then we'll know the kind of intervention that will be. Because, for instance, a child that is having severe, for instance, cannot go beyond primary 1. If you put it in school, it will just be there. Maybe they push to primary 2, it will be there and all. It's not as the reading and understanding is not the issue for them. Most of them, for the rest of their life, what you will be training them in how to take care of themselves, how to bathe, how to clothe, how to fasten their belt, and that's what you'll be teaching them majorly. So you cannot compare the intervention for someone that is having severe with the intervention for somebody that is having mild or moderate. They are two different categories.
Interesting. Thank you so much, Daddy. The questions are coming in fast and thick. Permit me, at some point we would have to stop so that we can go to the next presenter. But before we stop, Alamin Abolore says, how can one help a dyslexic child to be an independent reader? Is it achievable?
It is achievable. A dyslexic child can even read medicine if they discover it on time and they can. The proper intervention is given to the child. There is nothing the dyslexic child cannot do.
Interesting. Hafsa Agbabiaka says, please, how can one deal with the deviant behavior? I am always afraid that there is something wrong with them repeating the same things over and over again. That's understandable.
Please, let's watch it, because there is none of us that will look at the children will not see something that they are not healthy sometimes. But is it persistent? Are they persistently breaking the rules all the time? Are they taking are they taking opposition to every norms in the society, in the home and everything? They are just breaking them without caution. That is when it calls for help. But that's when they call for attention. But if it's, children will want to be children. Once in a while, they will do some things and you call them, you correct them. One other problem I see with most parents is that we beat without explaining what they do to them.
Very common, sir.
We beat without explaining. So I encourage parents to do contracting. You understand me? Do contracting with them. You understand me?
Okay.
Because
when you say contracting, what do you mean, sir?
Okay.
Turn them to a contractor?
No.
Okay.
Now, when you are doing for behavioral therapy generally, is divided generally into two forms. There is a technique to extinguish unwanted behavior, which are the techniques they use for fear, phobias, anxiety. There is a technique that you use to bring about desirable behavior, which are the techniques that you use to bring behavior that ordinarily are not there, but they are the desirable one that you want the child to elicit. One of them is cognitive, we call it grammar rule, and cognitive contracting. No. When it comes to me, I will give it to you. So, grammar rule is one. Then you have this other one, which is divided into timeout, shaping, and token economy. You understand? So when you when you use it for them, what you need to do basically is that look, come, this is the way I want this thing to be. And if you don't do like this, this is what I will do for you. I've entered into a contract with them. So when you enter into the contract with them, you have told them, they knows the rule. They know the punishments that follow. They know what they will lose if they did not follow it. So when you enter into that contract with them, let them, if they do it the first time, probably because of ignorance. You understand me? So the second time, once you see it and you reprimand them, tell them, with regards to this is what I expected. This is the rule. This is because you have done it now. I did not beat you because you did not know. Next time that you do it, this is what I am going to do for you. So don't do this. This is not right. This is the right behavior. So it's like you are doing a cognitive, you are doing contracting with them.
Yeah.
You understand me? You are contracting
to make them know the result of what they do, and there's
an
agreement.
Yes. So whichever way it is,
I understand perfectly.
Once you enter into it, they know. So when next they do anything in that direction.
Okay, so it seems the network is playing a fast one.
Okay. So the next time they do it, despite the fact that they knows the rule, just call them. Come. What did you do? I've done this. What is the rule in the house? This is the rule. Anybody that does what the punishment, this one. So what should we do to you? Judge yourself. So with that,
so nobody will off their mic.
With that, they know.
So nobody will tell them it's okay, I off their mic. They will be the one to judge themselves.
Yeah, they will be the one to judge themselves. So that's
fantastic.
And when you find them on the right side of the law, please do not hesitate to apply the discipline
and commend them.
Make sure you do what you said you will do if they do it.
The reward. So that they don't think it's just empty threats.
That's another thing that affects most children now. When you say it, when it's time to take action, we'll say, no, okay, just go. They won't take. Once you have done that, they will do it again because mommy will always say, just go.
Just go. I don't want to beat him. So I don't want to reprimand him. Okay, thank you so much. Because of time, I'll take just 2 questions. And please, audience, my people, I believe you'd agree with me. I appeal to you that I will just take 2 questions because of time. So from Sari Ukuye, she says, can those who can't go beyond GSS3 be helped to get into handwork? I'm coming.
Okay. Sorry, the word I was looking for is contingency management.
Contingency management. Okay.
When you want a behavioral therapy, when you be a therapy to bring about desirable behavior, there are 2: contingency management and token economy. And grammar rule. Contingency management is divided into 4. The first one is contingency contracting, which is the first one I've told you now. The second one is timeout. The third one is shaping, while the fourth one is token economy. Reward a child when he does what you agree that he will do. Give the appropriate reward so that he can continue to do that. So I think I've cleared that. So let me get your question, please.
So yes, the question says, can those who can't go beyond GSS3 be helped to get into handwork?
Yes, that's what I have said. That because they are able to go to school to a particular level, that education that I have acquired is very handy for them. So when they get into any trade, it will help them. A child that can read 1 to 100, that can read 1 to 1,000, that understand numbers, operation, addition, subtraction, multiplication, division, and all that. If you take such a child to learn fashion design or sewing, they can count, they can measure height and waist and all that, they can adjust and reduce. If you take them into welding, they know how to measure. They can do anything that they want to do. But for a child that cannot even count 1 to 100, cannot do numbers, operation, addition, subtraction, multiplication, and division, if you take such a child to fashion designing or welding or carpentry, they will not do well because they do not have such experience to fall back to. And that's most of the problem that you see in the society, where because they did not assess them to know the level at which they are functioning, they would take somebody who is at severe to go and be learning organizer or to learn carpentry, and they will be there for 15 years. They will say they did not learn.
Not move.
Yes, they could not move because they have not achieved enough number of operations to be able to do well at the level, at the vocation that you have put them. So you need to assess the level of which they are functioning before you put them somewhere.
Oh, time is not our friend at all. A child, okay, Rukoya Arogbadamu said, is there a problem where a child is unable to focus, and how can it be managed without drugs?
A child that is not able to focus is likely to be a child that is having attention deficit. We call it attention deficit.
Attention deficit.
Attention deficit. There may be the other side may be there, may not be there. That's a hyperactivity. It may be having attention deficit hyperactivity disorder, but there are some of them that are having attention deficit hyperactivity disorder that the major issue there is attention deficit, like a child that cannot focus. There are some that the major problem would be hyperactivity, like those that cannot stay in one place. The third one could be both attention deficit and hyperactivity together in one child. So a child that is not able to focus is likely to be having attention deficit. But if that attention deficit is now affecting his ability to perform his duty, ability to do his house chores, to do other things because he cannot focus on what he's not able to finish, for such a child, he will not be doing well academically in school because he cannot focus on tasks, he cannot focus on attention, on assignments, he cannot get it through. For such a child to do it, you have to sit down with the child. And so every child that is having attention deficit and is affecting his functionality, whether at home, at school, and other, so he may be having attention deficit disorder. Which is
Thank you very much, sir. Final question. I want to take this question because, I also have a related case like that. A child of 4 loves cartoon and relates what he has seen. What could be the effect? Final question.
Well, we see that in most homes now, and that's one of the things we challenge, because honestly, I will encourage you to sit down and watch this cartoon with them. You will see some of the terrible things. Most of the social vices that we are experiencing now, substance use, homosexuality, and all that, many of them are brought to these children through cartoon. And because we parents did not feel caution to watch the cartoon with them, you understand, to see what is there. So for such a child that is addicted, according to your word, to cartoon and is already relating what he saw, don't be surprised if you watch cartoon that is substance related, he will try substance. He will watch cartoon that is sexual abuse related, he will try abuse. If you watch cartoon that is violence, generally he will be violent and aggressive. So because that's what
wow,
they will try it. They are still very gullible. You cannot decipher the truth from the other one. So that's why we need guidance in anything that they are doing. A child of 4 watching cartoon, and you need to start regulating that.
Exactly.
To start regulating it. Because some of the things that child knows now, you don't know he or she knows it. Because a lot is going on in the cartoon world. So once you have exposed your child to cartoon, you can no longer vouch for your child, what he can do and what he cannot do. That's the truth.
Wow. Coming from the psychologist. I can't agree with you less. Thank you so much, sir. Just for the record, it was Rashidat Olaniyan that asked that question. Thank you so much, sir. Dr. Afolabi Aroyehun. It has been a very wonderful session. Very wonderful. In fact, I was hitting my table here that it's okay. But because I couldn't off your mic, and I was enjoying as you were dishing out those wonderful food that you have cooked, and you served it on a Chinese bowl with all the garnishing by the right and the left. You couldn't wait. Thank you so much, sir.
I focus on
yes.
I focus on intellectual impairment because I realize most parents now, that's all we know. Just go to school and get me good grades. There are a lot of other disorders in children. In children that needs attention. But because we do not have time to go there, I just decided because this one is what all of us have been home now. We've been with them now for the past 3 months, and we are waiting for the school to resume so that we can throw all of them back and all that. That's what it is. So please, there is much more than this. Seizure disorder is also a mental health disorder. Now you call convulsion, all those ones. They are also mental health issue. If your child is running away from home and going to stay with a guy or something, it's also a mental health issue. A child like so cruel to animal, kills anything anyhow or another, and is always opposing every view that you have. It's also a mental health issue. There are a number of them that we continue to mention, but because all of us now, we have turned to teacher now, our focus should be on academics of our children. That's why I picked that particular area to discuss on. So thank you so much. I really appreciate it.
You're welcome, sir. Thank you so much for sharing your knowledge with us. And I believe the organizers of this event have already listened, and I'm sure they would have to organize another session to bring you specially so that we can listen to the depth of this analysis you are giving us. The way you're serving it, there are some things I'm hearing for the first time, this scapula, this graph. I only know dyslexia, you know, but I've learned quite a number of things from you. Thank you so much, sir. Thank you so much. All right. This is the time where let's move on to I'm very sorry, all of you, that I have not been able to take your questions. My apologies. You agree with me that the topic was so interesting and we had little or limited time to take questions. So let's move on to the next presentation. And you see, this presentation is very, very, what's the word? Is very, very important in all sense of it. You need to listen to it, provided you are an individual. Whether you have a child or not, you need to listen. And this is a message that is coming from someone that was depressed at the age of 10, and the only way she thought she could go was to take her own life. She wanted to commit suicide. Having walked this path of intense darkness, this person can relate with teenagers who are going through emotional challenges and are struggling to see the beautiful side of life. Life is beautiful, I agree. This person is a therapist and anti-suicide activist. She has also learned effective strategies that parents can use to identify and help their children with mental health challenges. The person I'm talking about, in case you do not know, is a lawyer, a community mental health facilitator and trainer. She is a play therapist, this person that plays. So I'm sure we're going to play a lot during this session. She's a play therapist. She's the team lead of Play Therapy World. Please, I need to join that world. I can see play there. She's an emotional bliss and mental harmony coach. She's also the Own Your Essence therapist. In case you do not know who I'm talking about, sit back, relax. Let me introduce to you. No, I've introduced. Now, let me present to you my friend. She was not my friend yesterday, but she's my friend now. We are speaking because I already know her. I can see her face. I've read her introduction. And by the time you start hearing her, I'm sure she'll tell you she's also my friend. Please join me to welcome Zurel Oluwabukola Olowe. Zurel,
hello, everyone. Hello, everyone. Good afternoon or good morning. Good morning. And okay. How's everyone doing?
Good morning.
Good morning. Yes, thank you. It's a great honor.
Hope I pronounced your name correctly.
Oh, you tried. At least the Olowe is what you almost. The Olowe is what you almost killed now for me.
Olowe. Yes. Okay. Olowe. No, correction taken now. You have the floor.
No problem.
Thank you.
Yes, thank you so much. I really do appreciate the first speaker. He definitely, that was a top-notch session, an amazing session. I honor you, sir, for that amazing session. So let me go right deep into my session because I have another speaking engagement at 12:20. Okay, so let me start with this. One thing parents should understand and should know is that their children have the capacity to hide their emotions. Never assume you know your child's emotion. Never assume you can determine your child's emotion. Never assume you can dictate your child's emotions, most especially when that child is going through a crisis. And this crisis can stem up from what is happening in the home and is transcending into the life of the child. It can also stem up from what the child is experiencing in school, and it can also stem up from the place where the child is. Now, an example is when there is chaos in the home, when there is a crisis in the home, and your child is aware of what is happening in the home. If your home had always been a home of bliss, a home of harmony, a home of joy, and all of a sudden you begin to have crisis in that home, never ever take the presence of your child in that home for granted. When your child is experiencing bullying, when your child is experiencing issues in school, and all you are doing is you're saying to that child, it is well, it is okay, can't you fight back, can't you talk back? What you're unconsciously doing to that child is you are telling the child to destroy his or her self-esteem. So when your children begins to get to the age of awareness, and sometimes the age of awareness is not really cast in stone, because some children's IQ is top-notch. Some children are fast learners. Some children have the capacity to observe even more than you as a parent. So always be aware what is happening to your child and what is going on with your child, and be present in the life and happenings of your child. So I'll tell my own story. My first attempt at suicide was when I was 10, and that stemmed up from what was happening in my home as a child. So nobody knew what was happening. I was a bubbling child. I was a happy child. Yet I was going through a mental health challenge that no one knew. About that period, I was depressed. When I'm alone, I am depressed when I'm alone, because I know how to internalize my pain. I know how to internalize my emotions. I know how to internalize my feelings. And I was able to internalize it so well that when people see me, they see the bubbling Zuriel, they see the bubbling Bukola, and I play. However, I was going down the drain even as a child. And that was when the spark got for me and I could no longer take it. And I tried to take my own life. Now, at that point, nobody knew what was happening. Nobody was aware what I was going through. But as a child, did I go through my pain? Yes, I went through my pain. The adults and caregivers, remember, adults and caregivers who were supposed to be observant, who were supposed to monitor what was happening to the child in their house, were not even aware of it. It took my second attempt when I was like the age of 13. That was when people got to realize what was happening to me. Never assume you can predict your child. I say to parents always, never assume you can predict your child. And never get to the point where you feel that, oh, mental health issues is only for adults. Children, teens are on the high rise right now. Right now, statistics shows that the people who suffer mental health disorder or mental illness right now are more in the range of the preteens to the teens. And most times, mental health disorder happens to a child before the child's 14th birthday. So you can imagine everything a child has gone through in life from the age of maybe 6, maybe 7, 8, and everything is bubbling out like a bubble. Because when it comes to mental health, it starts like a balloon. So when you begin to blow your balloon gradually, you begin to put your hair into a balloon gradually, it's increasing, it's getting big, it's getting beautiful, it's getting amazing. It gets to the point where that balloon can no longer contain the hair. The hair is looking for how to come out. So what eventually happens is that the hair bursts the balloon. That is what mental health issue is all about for children. A child does not have the tool, a child does not have the capacity. A child does not have the ability to be able to know what is happening to him or her. So sometimes we, as parents, you just assume, oh, my child is just being moody. My child is being cranky. Oh, my child is just throwing tantrums. My child is throwing all nuts. But because you do not know what is happening to the life of the child, all you just say to the child is, go and sit down, you're disturbing me. Go and look for somewhere to stay, leave me alone. What is wrong with you? You are too quiet. You used to play. Why are you sitting down? Why are you getting moody? When you notice this in your child, it may be a sign or a trigger for you to find out what's happening to your child. It may be a sign for you to ask your child, what is happening to you? And it may be a sign for you to ask yourself, so what is happening in the house? As our home become a toxin home, as our home become a home filled with toxins, what is happening between myself and my husband? What's happening between myself and my wife that has transcended and has become toxin to our children? What is my child reacting to? Is my child facing challenges in school? Is my child facing issues with the teacher? What is the academic challenge my child is facing? When your child is facing an academic challenge, you don't go destroying the child with the words of your mouth. You don't go calling your child Olodo. You don't go comparing your child with their sibling or with their cousins or with a neighbor. Each child has their unique individuality. Each child has their unique learning styles. Each child has their unique coping style. Each child is built for their own relevance and for their own essence. So when you mumble up your children, when you mumble up your child in the guise that you want to build your child, or when you are trying to clone your child to become you, when you're trying to clone your child to become the kind of father you are, or the kind of man you are, or the kind of woman you are unconsciously damaging that child. One of the greatest myths that people are battling or people do not understand right now is they say that children do not experience mental health issue. Breaking news, they do. Breaking news, it is happening. Breaking news, we are working with a lot of them. Breaking news, I was one of that child. So do children experience mental health issues? Do children have nervous breakdown? Do children experience anxiety? Do children experience bad panic attack? The answer is yes, and it is huge on children. And why is it huge on them? Because one, they cannot even express themselves. They do not know what is happening to them. So a child sometimes wants to play, yet finds himself or herself getting withdrawn from play. A child himself wants to be the party life of the environment, yet cannot perform well, because in the mind of a child, there is something bigger in that mind, in the head of the child, in the mind of the child, saying to the child, you are not good enough, you are worthless, you are useless, saying to the child, you are the cause of the problem in your parents' house, saying to the child, if you were not born, maybe your daddy and mommy will still be having fun. If you were not born, maybe your siblings would be amazing. If you were not born, if you are not in this class, maybe. And a whole lot of these maybes and ifs are the things the child cannot find an explicit explanation to and get the child begin to act up. So when your child begins to throw tantrums, when your child begins to have panic, anxiety, panic attacks, when your child begins to get depressed, that is not the point you want to do what? You want to go all out for the child and start condemning the child or start blaming the child. That is the time as a parent you want to ask yourself a question. What is not adding up here? What is not adding up here? So children don't experience mental health problems. So people will say children don't experience mental health problems. They are only moody. No, they are not moody. They are going through a challenge. Then one of the myths, another myth again, people tend to say is that, oh, why will you take your child for counseling? She's just a child. Why will you take the child for therapy? Why will you take the child for counseling? They don't need it. All you need to do is talk to go and pray. All you need to do, go and see pastor, go and see your imam. No. As much as you want to do the prayer aspects, as much as you want to do the religious aspect, never ever take away the aspect of professionals. They are trained, they are skilled, they will run the right assessment on your child, they will ask the right questions. One of the things I do as a play therapist is to use play as an intervention to analyze and to run assessments on children who have experienced traumatic events, or children who have gone through a stage of life that has altered them and has altered their mind. So taking your child to therapy is not a taboo. Taking your child for counseling is not a taboo. When a child loses a certain parent, when a child is taken away from an environment where that child is used to, what the child has gotten accustomed to and has adapted to, and you're taking that child away from that environment to another environment, even if you're taking that child abroad, you must prepare the mind of that child. I have seen instances where people have said to children, maybe a spouse passes on, and they are saying, "Oh, she's just a child. It's just a child. She does not know anything. He does not know anything. See, the child is playing." No, the child may not be able to express that. What is happening? I can't see my mommy. I cannot find my daddy. My daddy is not coming back. And you just assume all is well with that child. All is not well with the child. The same measure of pain that you go through, the same measure of disappointment and hurt you go through as an adult when you lose a spouse, that is the exact same measure of pain and hurt your child experience when they lose a certain parent. So the myth to say that that child is not experiencing it, the myth to say that the child is not feeling it, the myth that says that the child is just a child, he does not know anything, the child does not see anything, the child cannot feel, it's a lie. What is happening to that child at that point in time is that the child has most likely internalized what is happening. And as the child is growing, the child will begin to ask questions. When your answers to the child question is, "Oh, daddy has gone to heaven, mommy has gone to heaven," and you're not able to sit the child down and tell the child that this is what has happened, or get a professional to explain to the child what has happened to the child or to the parent, how the parent would not come back anymore, how the parent died, and all you're doing, you're just giving mumble jumble to that child. What you're unconsciously saying to the child is that everyone needs to go to heaven. I have seen children try to take their own life because the hangout in the life of the child told the child, "Mommy has gone to heaven, daddy has gone to heaven, to a better place." And in the mind of the child, heaven is a better place. Heaven is a sweet place where my mommy is, where my daddy is, and I want to go meet them. So that is a wrong training. That is a wrong teaching. Another myth that we say is that, "Oh, give the child drugs, the child will be okay. Just take the child to the hospital, let them give the child drug, the child will be okay." No. Most often than not, children are not given medication. Most often than not, one of the first treatment given to children are not medication. So what they try to run is to have therapeutic interventions with that child, and when it is necessary to give the child medication, when it is necessary to give the child medication to help the child's mental health, medication will be given to that child. So when people feel, "Oh, if you just take the child to the hospital, they'll just give her medication, they'll give the child sleeping pills, the child will be all right." No. So if you have anyone who has said to you, "Oh, I took my child to the hospital and they just gave the child medication and the child is okay," that child was not having a mental health issue. The child was most likely having another kind of issue. And doctors most likely realize that you do not give the child, the child does not need therapeutic intervention. What the child needs is a medication to treat the child. Yes, thank you. Yes. Children experience low self-esteem and become inferior. That is a yes, thank you. So another thing is that another myth we also experience that is that to say that, "Oh, when children are having mental health issues, it's as a result of bad parenting." No, it is not as a result of bad parenting. In most cases, it's not as a result of bad parenting, because as parents, sometimes you would have done everything amazingly well, everything awesomely well. You would have given your best to your child. However, there comes a time when a child is going through their own personal phase. There comes a child when a child is experiencing their own personal challenges. And when they are going through their personal challenges, they are not able to express themselves. They begin to do what? Dwindle down. So as a parent, I always encourage parents. So one of the things I tend to do with parents is when they bring their child and they're saying, oh, my child is going through this and we've done everything we need to do, and find out, oh, this is a mental health issue. One of the things I tend to ask parents is, what is your home front like? What kind of parenting skills do you run? What are the things you do as a parent? So when I find out that everything the parents have done, have said, are things that are amazing and awesome, then it just means that it is not a fault of the parent. But when I find out that the parents, they themselves either contributed or are the masterminder unconsciously, then you need to work with the parents. So sometimes, a whole lot of times, it is, or sometimes it is not as a result of bad parenting. So parents who get to go on the wild goose chase, blaming themselves. I say to you, parents, please stop blaming yourself. But sometimes when you start blaming yourself, you lose focus on how you're meant to help your child and help your child to grow and become better. Also, it is important to know that as a parent, you have the right talk. Never assume that once you see your child, you can read your child. No. Do not stay on non-verbal communication alone. You need to create the avenue for verbal communication and non-verbal communication to speak with your child, to understand your child, to analyze your child. So I would say to parents, even when your child is 4, when your child wakes up in the morning, one of the first things you want to do with your child is ask your child, so what happened in your sleep? Did you have any dream? How was it? What happened? Ask children questions. What that will help you do is it will help you understand their sleeping patterns. It will help you understand their thought patterns and their thought process also. So do not feel that, oh, so there's this, I've met parents who have said to me, oh, my child is just 4, my child is just 5. I don't think it's necessary for me to have a discussion with your child. No, it is necessary for you to have a discussion with your child. Because children that are 4 years, 5 years, hold your tabs, they play with your tabs and things pop up. Sometime last year, we had an 8-year-old who committed suicide because this 8-year-old was watching a game on the mom's phone and something popped up. And what popped up was teaching the child on how to commit suicide. And unfortunately, this child went ahead to commit suicide. I've had a teenager who also lost her life, who committed suicide because the father and mom had issues. The father and mom had issues, and in the process of filing for divorce, she felt she was no longer loved. And what happened was she was looking for love outside. She met 2 guys who slept with her. She got pregnant. And unfortunately, these 2 adults who were having issues settled their quarrel, using her to settle their quarrel. And she ended up committing suicide. Now, we had a 16-year-old who committed suicide with 3 months pregnancy in her. So as a parent, taking your time to analyze yourself is important. Myth, let me do a recap of the myths. Never assume that children also and teenagers also do not experience mental health issues. They do. Now, on the level at which they experience it is what your psychologist, is what your therapist would help you analyze. If it is bipolar, if it is depression, if it is anxiety attacks, if it is mood swings, they would help you analyze it. So never assume that it is just drugs that they will give to the parents. Never assume, they will give to your child. It is not just drugs. So number 3, never assume that all is well with that child, that your child is just being a child. No. Also, mental health disorder is not a personality issue. It's not a personality issue. It's more or less, it's like the everyday illness people tend to have, and it is treatable. Please don't feel that it is not treatable. It is extremely treatable. It is extremely manageable. Then also, when you have, so I always tell people, finally, let me say this, finally, I always say, please find out, try as much as possible to know the history of your family. Try as much as possible to know the history of your family. Has there been someone who has had a mental health issue, and what was the level of this mental health issue? Because some are hereditary, and it may not pass down from that person who had it to the third generation. It may begin from the fourth generation. So you also want to find out. So somebody just asked a question: what are the benefits for children watching cartoon? So you also want to look at which cartoon channels the cartoon channel watching. The first speaker said that you must sit down with your children to watch those cartoons. Yes, dear parents, sit down with your children, watch the cartoon they are watching. Ask them questions when they finish watching cartoons. Sit down with them, watch the cartoon. When they finish watching cartoon, ask them. Children are emotional beings. Children are miniature emotional beings who would grow to become adults. And if their emotions are not managed well as a child, and they grow up with a distorted emotions, they become a damaged adult. And when they become a damaged adult, it becomes difficult for you to treat or for you to manage. So take your step-by-step walk with your child today, work with your child, move with your child, engage your child today. Know what is happening in your home. If your home has become a toxic place for your child, take your child away from that toxicity, that toxins, and go walk. Take your child to a place that is safe and sane, and help your child. Thank you very much. I told her I had 10 minutes more. So I think my 10 minutes is up.
Wow, 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 wow. I'm standing, I'm on my feet. Zuriel, what you have done
please.
this morning is you have opened the heart of a lot of people. I see questions coming in, and from the tone of the question, I can see that everybody is in tune with everything you are saying. And you know, the funny thing is that why I can actually connect with what you are saying is that I can't remember the particular age, but in line with what the first speaker said, when we are so concerned about academics, when I wrote my first WAEC, the only two subjects I passed was IRK and Yoruba. I failed every other thing. Every other thing. But do you know what I did? I attempted suicide.
Wow.
Why? A number of people that know me here will be hearing this for the first time. Why did I do that? Because at home, my home where I'm coming from, first child, you know, no book, you fail, you are a dead man. Dead. So I just thought that, okay, since if I get home, I'm a dead man, why don't I just cook dead now? You know, let me kill myself now, you know. But I thank God that funny enough, the woman that rescued me today is in turn my mother-in-law. You know.
Wow.
So so a quick recap. You know, you have done a fantastic job. Let me just quickly mention the things I learned. One of the things you mentioned is that the phrase "it is well," we need to look at it properly and try to do away with it. You know, dig deep into issues to understand, not just saying it is well. We need to understand that different children have different age of awareness. We need to understand that mental health is like blowing into the balloon. And as the balloon gets bigger, if it is not curtailed or guided or watched, it will get to a stage, it will just burst. Again, you told us that children have their own way of internalizing pain and feelings. That was very profound for me. You said we should never assume that we can predict our child. That again is something very, very key. You know, a lot of us believe, is James. I know him. He can't do it. So we should never assume we can predict our child. That, you know, struck a chord in me. Again, you said we should notice the change in mood when we notice the change in mood or behavior, then the question we should be asking is, what is happening in the home? What are we doing right? What are we not doing right? Not to be thinking everything is cool, prim, and proper. You said each child is unique. You need to start asking, what is my child reacting to? You told us that children experience mental health issues. Gone are those days where children do not, or we believe children do not. You told us that the two clauses of, or not clauses, the two words, maybe and if, these are statements that cause children to act up. And when we see this, we should ask ourselves what is not adding up. Again, you told us that counseling and therapy is not a taboo. We should accept it and be open to it. You told us, and I like this particularly, that when there's a change of location or situation, we need to prepare the mind of the child. We need to have a discussion to prepare the mind of the child that this is happening and this is happening. There are so many lies we tell ourselves about our kids that I picked. You told us that we need deep, clear explanation of issues and situations to our child to confirm their correct understanding. So don't assume they understand. Again, you said we need to use all forms of communication, verbal or not verbal, to speak to and analyze our children. You said we should ask our children probing questions to help us understand their thought process. Profound. Finally, before I go to the questions, you said children are miniature emotional beings. They grow to become adults. So if we do not help them to guide and manage their emotions, they might grow to be adults that we do not like. Very deep, deep, deep discussions you have stirred up in us this morning. So I'll jump straight to the question. So
please let me take it. There's a question I need to answer. Let me answer a question.
Ahead.
Somebody said, how possible is it to sit down with your children to watch cartoons when you have work and house chores to do? So let me say this to you, and I'm going to say it with all seriousness. You know, I've been laughing since. I'm not laughing with you now. That person answered that question. Asked me that question. So let me just see your face. See, if you don't want people to re-engineer your child, if you do not want people that you do not know, you have not seen, that have no you have no control over them, to control your child, you sit down and create time to watch the cartoon.
Watch the cartoon.
There is a form of watch the cartoon they are watching. There is a form of re-engineering that is taking place through cartoons, and you don't think it is cartoons. It is not cartoons. See, nobody will tell your child. Nobody is telling the teenagers outside today that they should sag. Nobody brought them into classroom.
What they see.
They see they are sagging. Nobody is telling them that you should smoke Igbo. They see they are smoking. Your parenting results will show up when your child is 18. That is when your parenting result will show up. So everything you are doing with your child today, your child is in your school.
Your child is 18.
Your personal development school. So when you, as much understand that there's a whole lot of work to do. I understand that there's a whole lot of house chores to do, but breaking news, dear parents, you're not a Superman. Another you're a superwoman. It is not a
hey, Zura, you need to tell my wife this thing. No, you are not a Superman. You're not a superwoman. You need to tell my wife, you are not a superwoman.
Sit down and watch that cartoon with that child. If not so, can I speak Yoruba?
Speak, oh.
The things we don't know, we will not train our children for us. So please, madam, see, if you do not cook soup that they drink gari in the house, sit down and watch that cartoon.
Abi? Benny. Thank you so much, Zura. So from Karima Jagun, Karima says, will you advise a parent to shout down a child for crying, be it necessary or unnecessary? Would you advise?
No, so I'll say no. When you use shouting to react to a child, the child sees shouting as a norm, and that child would also start shouting. So it becomes a shouting in your home.
So shouting family.
Yes, you become a shouting family. So what you want to do with your child when your child is crying is to create an empowering distraction for that child.
Please break that down.
Yeah, empowering distraction for the child, empowering one. So let me give you an example. Say a child is crying. What you want to do, you turn that child's crying to your music and start dancing to the music. You turn it to your music and you are singing along when the child is crying. And you are dancing. The child is hey, we are dancing. The child herself will eventually be wondering what is wrong with me. Is my mommy okay? Is my mommy normal? Because the child knows. See, when your children can predict you as a parent easily. They are smart. Children can predict you easily. So when your child knows that once they start crying, you get furious and you start shouting, you have given them something to be happy about. Have you seen where your child is crying and you are shouting and the child is laughing at you in their mind? Some children deliberately want you to shout. So if you have not shouted in the house a day, they feel you are sick. So let them know you are not sick by not shouting.
Interesting. Thank you very much. Next question from Amina Deji. Okay, so I don't want to murder any name, so I'll stop at Amina Deji. He said, is it right for educational providers to mentally abuse children? Is it right?
No, they should be sued, arrested. You should arrest anyone that mentally abuse your child because the person is damaging your child. I think one of the things parents have just subtly accepted, and that is what the first speaker was talking about, where he said teachers who do not understand your child would abuse your child. So they'll tell them, you are confronting me, you are doing this, go to the timeout. Anyone that mentally, emotionally, physically, psychologically, socially, any lead to abuse your child, any lead to abuse your child, cause your child pain, cause your child hurt, cause your child harm, damages the self-esteem of your child. Please pick the person up. Pick the school proprietors up. Pick the head teacher of that school, because if they have not permitted it, it will happen. And that's why I said earlier on that the things we do not know, they will not train our child. Your child is yours to protect. Your child is yours to honor. Your child is yours to guard. So if anyone wants
After all, it's your child.
Yes, it's your child. If anyone wants to take this from them and gives them a damaging personality, gives them a damaging life, please, it is a battlefront.
It's a no. Thank you so much. Because we are global now, we have some questions from YouTube. So it says, at what age does the child feel the death or absence of a parent? Then are mood swings real?
Okay, so the youngest child I've worked with who lost a parent was 3. That's the youngest child I've worked. Yes, 3 who lost a parent. And for this child, according to them that they brought the child to me, she was dreaming and seeing her dad. So when she wakes up, she's crying, daddy, 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 daddy. So basically, they brought the child, and what we did was to use a play therapy to work with the child and get in touch. So, like I said earlier on, some children's IQ are sharp. Some children get to know when it happens. Some children may not be aware, but they know something is really happening. So, okay, so an example is when you have a child that is a baby and a parent passes on, when the child begins to grow up and the child is seeing other children with their parents, the child may not talk, but know that the child is aware that something is not right. It is in the place of you, the parents, to sit that child down and speak with the child. When you are not able to do that, get a professional to do it. Please don't get a family member that is not a professional to do it. Don't get them to distort your child's emotions. So, but for me, the youngest child I've worked with was 3 years.
Okay. Thank you for that. Rukoya Iniola says, is it right for parents to stop their teenage children from having too many friends or talk to a neighbor?
Okay, so you need to understand your child's personality. What's your child's personality? Parents do not even know their child's personality. So when your child is a creative convertible, that's the ones we call the sanguine. I'm a family life practitioner. So the temperaments we use are creative convertibles. So those are the children you call sanguines. When your child is a creative convertible, they are the yaya ones. They are the ones that know everybody in the village. They are the community friends. They are the ones that will make you become popular in your area. Even in that area for 10 years, nobody knows you, but this particular child, everybody knows you. It may be difficult for you to help, to tell the child not to have too many friends. What you want to do is you want to work with the child to manage their friends. Now, when you're home, when in your home, when you do not have values, when you do not have values as a family, you do not have a particular template of values that you're running with as a family in your home, then it's impossible for you to work and manage your child and his friends and her friends. So what is your family values in your home? What kind of values are you running with? That your values is what would help your child, no matter the kind of personality your child has, that will help them run their life amazingly well and excellently well. So as a family, go draft your family values first. Go draft your family vision first. When you have that, then you know that you are running on a system. When you don't have a system, it becomes impossible for you to do anything right in your home.
Fantastic. Wow. Great nuggets there. Nafisa Abiola says, is there any advantage in children watching cartoon? I think you've touched on this before.
Okay, let me just say this. If I tell you that one of my greatest television shows are cartoons, will you believe me? I'd rather sit down to watch cartoon than watch any other thing, because for me, it's like a stress reliever for me. For me, because of my kind of job, I learn a lot of things from cartoons. So I work with children, I work with teenagers. Sometimes I even use my cartoon jobs. Sorry, am I opening my eyes too much? I tend to use my cartoon job to even work with adults. Sometimes when I'm doing team bonding for organization. So it's just for you to monitor the cartoons. Sometimes they learn words from cartoons. Sometimes they learn empowering plays from cartoons. So you need to manage their TV time. So manage their TV time. So that's why I say that. So when they're watching a certain cartoon, just sit down and watch. So you know the kind of cartoons they are watching and what is happening in those cartoons. So are there advantages for them to watch cartoon? It's for their age. It helps them, it calms them down. Have you noticed that sometimes when the child is crying and a certain cartoon comes up, the child just keeps quiet?
I'm telling you, very quiet.
Yes, it calms them down. You know, it takes them to a zone that if you're not a cartoon lover like me, you may not understand. You may be thinking, what is all this rubbish that they're every day? Please change the channel for me. No, you need to come into our world of cartoon lovers.
The world of cartoon lovers. Okay.
The world of cartoon lovers.
Adele B says, how do you know if the child is going through puberty emotions and not mental health?
Okay. So when a child is going through puberty emotions, you need to, one of the things as parents you also need to understand is when your child begins to get to 12, 13, there's a likelihood that that is the age of where some children start puberty emotions. Some children start earlier than that. So as a parent, have you spoken to them on puberty emotions? Don't wait until they start going through puberty emotions before you start speaking to them. The same way we say that once a child is 18 months, you begin their basic sexuality education with your child, where they understand their body parts, their private parts, their private and public parts. So once your child is getting to that age of 8, 9, 10, you know that some of these children, they're having crushes. So your child that is 4 years, 5 years, come to the house and it's always calling one girl's name. Ada in my class, Ada in my class. Or always calling today in my class. Some of these children tend to have crushes. So
no, it's not me.
So when you're checking them, so speak to them about puberty emotions. If you have taught them and spoken with them, when they're having that puberty emotions, they're able to come to meet you. Please let me quickly add this. As a parent, never stay in the position of a parent alone with your child. Never stay in that position alone. You need to create different kind of cocoons for your children. So you create the cocoons of friendship, create the cocoons of a coach, create the cocoon of a teacher, create the cocoon of a mentor, create the cocoon of a spiritual leader, create whatever cocoon you feel that you need to create for your children, so that you're able to swing when the need arises for you to play those certain roles for your child. Because if you're always in that position of a parent, you may not get everything from your child. Children would rather associate with someone who is a friend and tell them what is happening to them and their pains, rather than staying with a parent who is very rigid and not ready to hear from them. So create different cocoons where your children can meet you at a point in time of their certain need and specific need in those cocoons.
Interesting. For Mutiat, how practicable is it? Okay, please let me quickly mention that we'll go on for the next 5-6 minutes with Zurel, and thereafter we'll move to the final session. So please bear with us. This program would move till like 12:30, and I can assure you that at 12:30 max will be done. So Mutiat says, how practicable is it to always sit with the children to watch cartoon? Okay, I think you've answered this. Then where is that? How do we identify about what?
Somebody was asking about the difference between discipline and abusing a child.
Okay, maybe I've not seen that. I think, okay, this next one is how do you identify mental issues? I think you've also touched on that. Yeah. Where is it? Okay, how do we identify a toxic environment that can affect a child?
Okay, so when we're talking about toxic environment, so if it is in the home, an example is in the home, the spouse of that home are always fighting. They're always beating themselves. One particular spouse in that home is always insulting the child. The child does something wrong. What you are doing is to beat the child. The child does not do anything wrong. You are insulting the child. A home that is not emotionally and mentally empowering a child is a toxic home. An environment that is not empowering a child is a toxic environment. If you take your child, an example is, okay, so you move from a certain place to another place, and all of a sudden, you begin to notice that your child's behavior has become something that is alarming to you. Know that you've taken your child to an environment that is toxins filled. So what do you want to do? You want to pull out that child from that environment. You want to pull out the child. If it is in your home, you want to pull out the child from your home. If an abuse is taking place in the child, and maybe the sexual abuse, emotional abuse, verbal abuse, and is affecting that child's mental health, it is a toxic home. Home where in the morning the child wakes up, the father is saying, you are a bastard, you are stupid, you are mad, beating the father, beating the mother. Or the home where the mother wakes up, saying, if you don't give me money today, you are not going out, you are this one. It is a toxic environment. If that child does not meet intervention when that child is growing up, the child will feel that it is normal. The child will also carry that habit or attitude into his own home or into her own home. And it becomes a generational toxin.
Okay, God help us. Gani Ashitu says, I have a boy of 7 years going to 8. Anytime you call him to come and read, his mood changes.
Does he like play a lot? Most likely that child is a creative convertible, is sanguine. Just like the child is a sanguine. Also, you also want to find out. Yes, it's like that. Yes. So when you're taking them away from their play, you also want to find out what is your child learning style and reading styles. What is your child learning styles? So parents need to make a lot of sacrifices. I remember there was a time one of my goddaughters didn't like reading. She does not like reading at all. So what I did for her that period, I went to their house to stay with them for 1 week. So every time she needed to read, I would carry a book also, and I would sit down. I would pretend to be reading, and she too should also read. So we realized that, she wanted someone to be by her side. That was our reading style. So, so the father and the mom had to create a workable timetable for themselves that, okay, so if she's reading at a certain time, somebody needs to be there to be reading with her. And once you finish reading, you ask her questions, she gets all her questions. So sometimes you need to understand what is your child learning style, what is your child reading style. Some children enjoy reading with music. So when your child is reading with music, don't say, hey, you're making, how can you concentrate? How can you put focus? Leave the child understand what the child is doing.
Mm.
So what you need to ask the child is, can you understand what you're reading with your music on? If the child says, yes, mommy, I do, I can, daddy. What you want to do is after the child's finished reading, sit the child down, ask the child questions from what the child has read. You may not do it that very day, maybe 2 days later, ask the child. But don't assume that everybody must read at a certain way or a certain style. So for your 7-year-old that is going through, that'll be 8, you need to ask the child, okay, so when I call you to come and read, you don't want to read. So tell me why you don't want to read. Why don't you like reading? What do you want me? See, sometimes you need to bribe these children. You need to motivate. You need to motivate them. You need to motivate them. You are the one that wants doctor, what lawyer and engineer should be. So you will do the make them become a doctor and engineer. So you need to motivate them while for them to be able to sit down and read.
Interesting. If a child, Yusuf Fatima says, if a child is always proving stubborn and the parents doesn't want to beat, what can we do?
So when you say stubborn, what does stubborn mean? Or the child is just strong-willed? You know, parents don't like children that are strong-willed.
Yeah.
Just, how dare you? I'm telling you to do this. So what is stubborn? But sometimes I need to know what stubborn means. Does stubborn means that this child has his mind of his own? Does stubborn means that this child wants to do things his own way or our own way? So basically, when you say, okay, the child is stubborn, and what you want to do is basically create avenue where you both. The other speaker talked about contracting with your children. I call it bargaining with them, where you have to say, so we have to do this at this time. We have to do this at this time. And if we do not do this at this time, this will be the repercussion. So sometimes I say to parents, let your children pick their form of discipline. When they pick their form of discipline, you now scale it to what they are picking their form of discipline. So a child is supposed to be the one wash the plates in the afternoon, and the child did not wash the plate. So you ask the child, okay, so what should be your discipline? So if the child say, don't let me watch television, it's a lie. It means that child does not like television. So give the child 3 options. Let the child pick. That would be the form of discipline. I remember somebody was asking, what is the difference between discipline and child abuse? Discipline is to empower your child. Discipline is to right model your child. Discipline is to mold your child to become a better person, the person you want to see in them, and to help them correct their attitude and character. Abuse damages the child. Abuse takes the self-esteem of the child away. Abuse causes harm physically to the child. Abuse causes damage to the emotional and mental health of that child. So once discipline goes out of the form of remodeling the child, helping the child become a better person, letting the child know there's always a consequences for your actions. However, when these consequences are melted out on you, they are to help you grow. They are not to damage you. They are not to cause harm on your skin. They are not to damage your mind or your emotions. Then you know that is discipline. Anything outside that is an abuse on the child.
Interesting. Zura, we'll take 3 final questions. And I know time is up, but I need to take these 3 questions because they are very, very important. So Gania Shitu said initially she thought the boy was being lazy, but when you called him, he said, "Erumbami," meaning I am afraid. And he said, I did not beat him. What is the way out? When a child is afraid to do things, what is the way out?
So when a child says he's afraid, that is a trigger for me, even as a therapist. What has been done to that child before? What has that child experienced? What is causing fear in the child? What is the parenting skill and style of that home? The adults in the life of the child, how have they molded that child? How have they treated the child when the child does something wrong? What words have been used on that child? So children were not born afraid. Nobody was born afraid. We were all born pure, clear, like this glass of water. This is how we were all born, like this glass of water. So when a child now comes to the world and we are now throwing fear into a child, we throw fear, we throw damage, we throw pain, insult, we throw this, we throw that. What has happened to this water?
Lord, it's changed. There's no
So
more
that is
pure.
so that is what we do to children. So basically, what has been done to that child? Because if the child is afraid in his home, what is happening to the child outside? Is this child bringing fear from outside, or the fear started from that home? So that thing needs to be first and foremost discovered before you can. So you need to deal with the fear. So that whatever is happening now is the branches. What is the root cause of that fear? That is what we need to understand.
Of course. So Ghanaian Shitu, I advise you connect with the organizer so that you can connect with Zuriel. I'm sure she will either do it free of charge or she will charge you something. Whatever she charges you, just remember that there's a 10% commission from the. All right, that's by the way. Ariago Mutolib says, how do you manage the environment with a child who compares a lot and most times becomes jealous? A child who compares a lot,
who complains a lot, and most times who compares a lot, and most times becomes jealous. I'll also go back to the adults in the house. I also go back to the adult because that is how I work as a therapist. I tend to first find out the adults in the house, what happened, what is happening in the house. So was there a comparison somewhere? Sometimes it is just one comparison that takes place in the house, and it stays with that child for the rest of the child's life. And the child begins to build on it. So it means that this child is feeling inferior in the house. It means that this child has either been battered, so self-esteem is not there. The child's self-esteem needs to be boosted up. So parents of this child needs to sit the child down and let this child understand that you are loved equally with your siblings. So sometimes parents unconsciously throw love to a certain child and they don't know they are throwing it. So parents, so let me tell you, now let me just tell you parents, those of you that have 2, 3, you see those your last born that you're always treating like king and queen, better just stop it. The ones in front may not be able to talk now. But you see, when they gather and beat that your last born for you when you're not that old, when you come back, how you not take it. So, parents, make sure that what you're doing, you're treating each child equally. You're giving them equal treatment. You're treating them equally. Your firstborn are not parents. So the firstborn in your house is not the parent of that house. That you say, go and do this one. Can you don't you know you're the senior in the house? Your junior ones are looking at you. Let everybody look at themselves. Dear parents, let every child in your house look at themselves. Nobody is using anybody to train anybody. So stop using one child to train one child in your house. All of them came to the world separately on their own. You did them separately. Even if you gave birth to twins together, you did them separately. So treat them separately as a child. So parents, please understand the personality of your child. Personality is key. Personality of your child is key. Love language of your children is key. Know the love language of your child. Never treat one child the same with the other one when you have not understood their love language. Know their personalities, know their love language. It will help you treat each child according to the measures of how they have been created and wired by God. And every other training and wiring you're giving to them. So please, you need to go do that. And when you're able to understand that, it helps you understand your child perfectly and very well. So the issue of comparison will not take place. The issue of getting jealous or envy will not take place.
Fantastic, Zuriel. So I'll take this final question and you merge it with your final words to us.
Okay.
How do you manage a child that is shy and doesn't like talking, even in the most important place? Please merge the response with your final words.
Okay, so when you say most important place, where is the most important place? Is the most important place school? Or is it in your church? Is it in the mosque? Where is the most important place? The most important place is your home. Your home is the most important place. So somebody can say children's love language. Okay, please answer that. So your most important place is your home. That your child is, I'll still go back to personality. A people's personality determines who they are. So I am talking like this because I have been trained. I've gone through trainings. I've gone through a whole lot of re-engineering. Naturally, I am not a talker. Naturally, I am not a talker. So I can be in the midst of 10 After my Zoom meeting, I can be in the midst of 5 people and not talk for the next 5 hours. So what you need to understand also boils down to the personality. Then when your child is shy, so have a one-on-one discussion with your child. If that child is of age, have a one-on-one discussion with the child to find out what is happening to the child. Okay, so let's talk. So why are you shy? Mommy, I don't like it. I don't know why. So also, you can also help your child by throwing out direct question to that child. Train out that. Don't do open-ended question where you do not have where the child can avoid those questions. Throw out direct questions to the child where the child can be able to answer and speak up. So you have like 5 talking. You can just Lola, so what do you think about this thing now? So intentionally, but without the child knowing that you are brooding the child to talk. So finally, somebody asked about love language. So the love language you have acts of service. So you have touch, you have quality time, you have acts of service, you have gifts, and you have words of affirmation. Those are the 5 love language. Words of affirmation, acts of service, gifts, quality time, and touch. Those are the 5 love language that we have. So finally, let me say this. As a parent, when you fail to do the right thing with your child, the world out there is no longer a sheep. The world out there is a world filled with lions who are waiting to destroy your children, who are waiting to destroy the beautiful ones that the Lord has blessed you with. So I would encourage you as a parent today, be involved in the life of your child, be present in the life of your child. Ask questions. Do not assume all is well. Ask your child questions, and when they speak up, please, it is not the time to go broadcasting your children to the world. It's not the time to go shouting. Get the right help. Seek the right help. Stop making your children your family discussion. Seek the right help. Have a time out with your children. Have mommy and children bonding, daddy and children bonding, family bonding, family meetings. Have a time where it is just you, your spouse, and your children alone. That particular time, no visitor should enter your house. It is just your time to bond, to speak to yourself, to encourage yourself, to find out what is happening with yourself so that you can seek help, so that you can help yourself, and so that your children can become amazing children that you want them to become. Don't go cloning your children. Celebrate their individuality, celebrate their uniqueness, celebrate their awesomeness and their amazingness they have come to this world with. I remain Zuriel Oluwabukola Olowe, your emotional bliss and mental harmony therapist. Keep owning your essence. Teach your children to own their essence. You have an amazing day as a sign out. Bye.
Fantastic. Thank you so much, Zuriel. Thank you so much. I can't imagine where else would have gotten this kind of, loaded information, both from you, Dr. Afolabi, and now you have come to give us the organizers. I don't know what to say. I'm actually blessed to be part of this program. Well done. Thank you so much. Please let me quickly say, all right, bye-bye. Let me quickly mention that attendees, you are free to connect with the speakers, ask them your further questions, so let them reply via chat. If you need to meet Zuriel, just connect with the organizers. They would connect you guys up. So I promise I will be here out of here 12:30. I intend to keep that promise. And that is why I am keeping the biggest masquerade for the last. This person is not a masquerade. It's just that I'm trying to follow what the Yoruba adage says, that you see, that's end. Please go and find the meaning yourself. At least let me give you one work to do since morning. I've not given you work. Go and look for it yourself. Please join me to welcome someone that ever since I've met her, it has been value upon value upon value upon value upon value and quality. Who is this person I'm talking about? For those of you that know, I will just present her. For those of you that do not know, let me introduce this person that is going to talk to us in terms of question and answers, we have some questions we are going to ask her, and she's going to be focusing on the forgotten part of wellness. The forgotten part of wellness. This person is someone we popularly call ... because if I say that, a lot of people will know her. This person is so passionate about emotional wellness and essential skills training in children. Since 2007, she has been at the forefront of presenting a rare form of education for the mind and equipping young people for life outside the school setting. This person is a guidance counselor and an educational psychologist. She doubles as the CEO of Brainy Educare Services Lagos. In her quest to unmask the abstractness of teaching emotional health, she recently created a series of emotional wellness kits for children and teens, expertly designed to put children in control of their emotional well-being and grow into successful adults. These life kits are first of its kind, utilizing research-proven principles to help get best results. This person will be talking to us on the forgotten part of wellness. In case you do not know, I'm talking about the one and only, both in Lagos, Nigeria, and in the entire world, the only person that is called Ms. O. In case you do not know who I'm still talking about, please join me to welcome Mrs. Eniola Olajobi, Doctor.
Thank you so much, Mr. Adegbindi. It's good to be here. Thank you for the warm welcome. And I say to parents, good afternoon. Yes, I know we're running behind schedule. I would try to make it as brief as it can be. And as Mr. Adegbindi has said, I'm not really giving a talk. I will just be answering certain questions. Thank you.
Okay, thank you. So let's dive straight into it. Briefly, give us a foundation. You say emotional wellness or well-being. What does it mean? What does it mean?
Okay, so when we say emotional well-being, the term is simply put, as humans, we're made up of different parts. The three major parts that we're made up of is our physical body, which is what we see all the time. That is the body. Then we have the soul, and then we have the mind. So when we say physical health, anything that we do to our body is our physical health. Anything that we do to our soul is our spiritual health. And then whatever happens to the mind is our emotional health. So when we say wellness, we're talking about when we have good health or when we have the required balance in our mind, a balance that helps us to live life the way it should be lived. And this includes being able to adjust to good and bad, being able to adjust to the good, bad, and ugly side of life, being able to bounce back when there are challenges, and being able to have satisfying relationships. So that is a summary of what emotional wellness means.
Fantastic. Body, soul, and mind. Physical health, spiritual health, emotional health. Beautiful. So the next question would be, why do we refer to it as the forgotten part of wellness? We have broken it into three. So why do we say it is forgotten? You know, why do we refer to it as such?
Okay, so that simple question can take me over an hour to respond, but I won't spend that long, don't mind me.
Please divide that hour by 10. It gives you just a few minutes.
Yes. It is the forgotten part of wellness because honestly, let us analyze, let's evaluate ourselves. If I'm to ask everybody in the room, and we have about 100 parents in the chat room, we have people watching from YouTube and Facebook. If I'm to ask everybody to give me a list instantly of what they've done for their physical health today, they will not hesitate. I've had my bath, I've had breakfast, I'm dressing well. All of that is for our physical health. If I'm to ask what we've done spiritually, we won't hesitate. We have both Christians and Muslims in the room, and everybody's going to tell you how they've prayed, how they've done this, how they've done that. They've even read their holy scriptures and all. But ask people to write down what they've done for their emotional health or what they've done for their mind today. The first question you get is, what does that mean? They don't even know what they're required to do, talk less of doing it. So we have forgotten our mind, and we have focused for so long on our body and on our soul. If you look at the institutions, the structured institutions that we have, the home, the school, and the religious institutions, these are basically the three institutions that we have. Both in the home and in the school and in religious institutions, we deal with the two other parts of our body. Two other parts of our being. For example, in the school, we do physical health. When I was in school, I did PhD from primary 1 to I think just SS3, yes. I didn't do it in senior class. But some people have to do it up to SS3 depending on the course that they want to go for. So we learn so much about physical health. And then even in the home, where we're not learning it in a structured form, we learn simple tips on personal hygiene, how to brush your own teeth, how to have your own bath, how to dress well. When we become preteens, our parents will tell us color combination, in fact, sometimes they don't tell us. We just go ahead and even get better than our parents. And then when we look at spirituality, right from the first days of life, we teach these children to be spiritual. They go to school and they have religious studies, even in school. It's that for a school to be truly balanced, they must do religious studies. And they must go to
CRK.
Yes, we have hierarchy, we have CRK, we have, just to ensure that they learn about their soul as well. So where exactly are we learning, whether structured or unstructured? Where exactly are we learning as adults and as children about our mind? And that is why I refer to it as the forgotten part of wellness, totally forgotten. We know next to nothing about our mind. And even when we see certain indicators, we still ignore. And that is why a lot of the things that we've heard today from Dr. Folabi and from my sister Zura, a lot of them are overwhelming and we're like, wow. Because these are not things we've been doing. We have not paid attention to the things that matter. I read a comment from one of the parents, and I honestly feel you. I'm not judging you. I understand perfectly what you're talking about because I'm a mother too. A parent was asking, how do we juggle watching cartoon with them, with doing house chores and going to work? The honest truth is the children are better off not watching an unsupervised cartoon. So if we can't make out that time, they shouldn't watch it. We should engage them with something else. I'm also a very busy mother, extremely. But what I have done, and I would say that this has only been by the grace of God, but what I've been able to do over the years is I have been able to spend that required time with the older ones. So now when the little ones need to watch cartoon, their older siblings will watch it first, and they will be the ones to affirm it okay for family view. And the older ones I'm talking about, that one of them is an adult already, is over 18, and the other one is almost an adult. So those two already know over the years what is acceptable and what is not. In fact, sometimes they're the one that will tell me, mommy, see this. There's some things I won't even see. But before they were this age, I had to invest that time. I sit with them. If I can't sit with them, we can't watch that cartoon. I have to engage them in other ways. So it is very important because this is part of that food you're preparing is their physical food, physical diet. But the mind diet is that cartoon. Because at the end of the day, they won't just get entertained. They will also get impacted and their minds will be affected. So you want to bother about whether that whether that affect is positive or negative. Thank you. I think I'll just stop there.
Thank you so much, Mrs. O. Yes, very, very deep and detailed. So quickly, how do we then begin to take care of our emotional health? I know you've mentioned a part of it in this your submission, but just briefly tell us, at least like a step by step, what do we need to do to take care of our emotional health?
Okay. The first thing that we need to do is what we're doing today. We need to first of all realize that it's important. We need to advocate for this forgotten part of wellness to come back. If you've listened to me in the last 3 weeks to 1 month, I've been sounding like a broken record. Everywhere I go, even when the topic is not related, I just chip it in because we need to talk about, we can't continue like this. We need to talk about it. We need to realize that we're made up of mind, body, and soul. We cannot keep ignoring the mind and just focusing on the body and soul alone. When we realize this, we need to accept that it's important that we take care of the mind. We need to take it seriously. We need to talk to other people about it. And then we need to understand how the mind works. All of the things that we've learned today will give us, like a basic foundation of what we need to know. We need to understand that the mind is like the body and the soul as well. The way we feed the body we eat and we ensure that what we are eating is not spoiled food. We don't eat stale food. Some of us cannot eat cold food. If you want to eat your food and it's cold already, you're going to put it in the microwave because you want it steaming hot. So the same way you've known what works for your body, we have to start paying attention and knowing what works for our mind. So there are basically 3 ways by which things get into our mind. The things we see, the things we hear, and the things we think. So these are the channels. We have to get these channels and start asking ourselves, what am I seeing? What am I watching? And what can I hear? And what am I thinking in my head? So what we see, what we hear, what we watch is what we see. What we see, what we watch, what we hear, the second one, and what we're thinking in our heads. So these 3 gates, let us get it and check. We have to be conscious. So just about 2 or 3 weeks ago, there was a conversation on social media. Somebody had just read a book, and the book was traumatic. We're talking about serial killing and this and that. And, at the end of the storybook, the serial killers got away with it. And the person was, thinking aloud that, okay, so what have I learned from this book? And I don't think that we should, read or write books like this. But other people were commenting saying, that's not the issue. It's just for us to enjoy it, and entertainment is this, is that. And I said, no, we shouldn't see it that way. You are going to get entertained, right? But what is going to happen to the impact of what you've read on your mind? As a therapist, as a counselor, I cannot begin to tell you the number of children that I look at them, and I can be a very emotional person. Sometimes I'm almost breaking down to say, oh my God, this does not have to happen. I've seen children that are broken because of flashbacks that they have from cartoons. So we can't say it's just entertainment. We have to watch what they watch. We have to watch what they hear. We have to watch what they think. Most times what they think about is going to be a reflection of what they've seen and heard. I'm very careful about what gets into me, even now as an adult. But I would say that the beginning of my own checking my emotional wellness began when I was in secondary school. I am still a book lover. I used to be a voracious reader. I could read anything and anything. I'd read all the pace setters and all the what have you. And so, you start looking for books to read. So a particular day I had a book with me. I can't forget the title. It was called Black Waters. And my intro tech teacher, Mr. Agbala Jobi, yes, he called me and said, Eniola, what's this book you're reading? Can I see it? He took the book from me, read the back and said, you shouldn't be reading this book. This is a horror. And these are books that will come back to haunt you many, many years later if you don't like it. What do you gain from reading books like this? What is the essence of reading? Why do you read? And for the first time ever, I thought about it that, okay, really, what is this book doing to me? Apart from the fact that I'm going to improve on my vocab, it's going to increase my creativity and all of that. What exactly will this book do? And so my teacher gave me one good advice that I have taken, and several years on, I'm still holding on fast to that advice. So today, before I watch a video, you send me a video on my WhatsApp and you don't put a description, I will not download. You send me a voice note, you don't tell me what that voice note is about, I will not download. I want to watch a movie and I don't know somebody who has watched it can tell me that it's safe enough, somebody who understands me, I will not watch it, because all of these things will have an impact. For some of us as adults till today, we're still being traumatized because of the things we saw, heard, and thought about when we were children. I said it at a program recently, till date, I have not seen, and I'm not planning to see, the scene of what happened to George Floyd. But it doesn't mean I'm not relevant or I'm not aware. I know what happened, I know the details, but I will not watch that video, because what additional benefit will it do to me? Will it make me realize more how much of a serious matter it is that Life Black matters? I know that Life Black matters, and yes, not just life, every life matters, and I don't need to see it. And even if I saw it, I don't need to watch it repeatedly like most of us do. So for some of us, you watch CNN 50 times in a day, repeating the same negative news, replaying the same thing, and these things are going somewhere in our mind and they are messing it up, just like the drink and water example that Zuriel gave. That's just a very beautiful example, because that exactly shows what happens to our mind, whether as adults or as children.
Wow, Mrs. O, What else can I say? Very, very detailed and to the point. We are running out of time, but I'll make sure I take all the remaining questions. How can we help ourselves? Sorry, how can we help others, especially our children and family?
Okay, thank you. Very related to the previous question. To help our children, because we're here as parents, so our children and other members of our family, we have to talk to them. We need to have conversations with the children. The way we talk to them about their physical body, when they get to a certain age, we begin to say, oh no, don't do that. Let's go and brush your teeth. Let's go and have a bath. So right from their toddler years, you begin to tell them about their emotional health and what matters and what doesn't matter. And we can do this in very little. It doesn't have to be anything highfalutin or academic. For example, I have a toddler who is 2+, and he knows. So he loves to read books. He has a lot of books. But when he sees an unfamiliar book at home, he knows. He would ask. The first day he asked, I was shocked to my bones. He said, Mommy, good book or bad book? And I looked at him, I looked at the book, I said, good book. So he already knows that there's something called good book or bad book. So we should let the children know. Just a few days ago, a friend of mine, her son is also a readaholic, and I looked at the books that the boy was reading. It was Goosebumps, if we know Goosebumps. And a lot of this, in fact, they have the series Horrorland now. All of these things are not funny at all, because after a while, the kids get so traumatized. I've had to handle a child before who got so traumatized that he couldn't watch anything but horror. Anything he had to watch to get entertained had to be horror. And after a while, it got so bad that I felt, no, I can't even handle this. We have to refer to a psychiatrist. So what are we talking about? These things matter. We have to let the children know. Just the same way a child wants to take a stale food and you say, no, my dear, this food is false. Let me make another one for you. The same way they should know. So you find yourself watching a family program and there's something toxic in that program. Talk about it immediately. And then you've marked that program. You've already known this is not a program that you want your child to watch. But the moment, the right thing to do is not to switch channel. No, a lot of parents just quickly switch channel, keep quiet as if nothing happened. Talk about what has just happened. Tell them it's wrong, it's unhealthy, that violence is not good, whatever you want to say about it, and then move on. You know better now not to watch the same program again, or you know better now to ensure that you check before you even start to watch. So we need to let children know how to take care of themselves. Self-help is one of the things that I'm preaching, because you see, the honest truth is we have medical doctors and we have pastors and imams to help us with physical and spiritual health when things go bad. But on a regular day, we can handle the regulars by ourselves. So you know to brush your teeth every morning. You don't need to wait for your teeth to decay before you go to the dentist. But if you're still having tooth issues, then you go to the dentist. Or if you're just going for checkup, which is just twice a year. So the same way it should be for mind doctors or psychologists. So there's some basic self-help we need to do. Every parent should learn those basics. Don't allow your children to watch just anything. If they come across anything violent or age inappropriate, talk about it. Don't allow them to hear just anything. A lot of times parents are cursing this nation, cursing politicians right in the presence of their children. Before we go today, if time permits, please, I want to share a screen. You know, there's a conversation. It's a conversation between teenagers, but I have shaded out or I've covered up their names to protect their privacy. But it's important because a lot of times I say these things and it's almost looking like, Mrs. O is just having her own asodun. A lot of these children are very displeased with their parents. I'm not saying we always have to be their friends. Yes, we have to be firm with discipline sometimes, but a lot of times we are causing more harm than good with some of the things we say to them. We keep comparing, we say you're useless, you're a no do good. We say all sort of extreme words. We can't afford to continue like this because these children do not even have the kind of emotional fencing or emotional stability that you and I had, because then the world was a lot better, but now we're surrounded by emotional toxins. How many cartoons did you watch that were age inappropriate? How many violent cartoons did you watch? We all watched Voltron, Defender of the Universe. But what are they watching today? Monsterland, horror, and all sorts of things. So they don't even have the kind of emotional stability we have. Yet, we are saying more extreme things to them than our own parents said to us, at least in some cases. So we really need to be careful what we say to the children and what we allow them to watch and what we allow them to think about. We need to have conversations with our children. Thank you.
Mizo, it's clear that this issue is something very dear to your heart, and I can see it's in the way you speak about it, and it's actually very important. Unfortunately, like you said, is the forgotten aspect, the mind. The mind is where both the soul and the body is built upon. So if the foundation is poor, then the house would not stand. So quickly, we have seen the emotional kits that you created. So what inspired, creation of those amazing kits? What inspired it? There must be a reason. So what can you share that with us?
Okay, thank you very much, Mr. Adegbindi. I would say that at the beginning of this lockdown, so yes, a lot of us couldn't go out. Usually, my sessions would involve parents having to bring their children over to the office, but when the lockdown started, that couldn't happen. And what this meant was that I had to figure out ways to equip the children or their parents with what to do from a distance. And then the concept of self-help came to me that, okay, there should be some basic things that parents or children should be able to use to help themselves, not necessarily have to come all the time. Yes, there's sometimes, no doubt, we may need to get expert help, but there should be some basic preventive measures that we should be able to take. And that was what inspired the self-help guide. So for the first few people that had counseling sessions with online, I would send them charts, I would send them templates that I would usually ordinarily use for them. I'll send it to them that if you can be ticking this, if you can be noting this, if you can be, I did all of that until I realized that, okay, there may be so many others that do not know Mrs. O, that cannot reach Mrs. O, or that can't afford to pay for sessions. What can we do to help spread this word? Because it's like an entire movement, and we have to realize that it can't be something we keep keeping to us. In fact, I'm hoping that schools and educational institutions can have this incorporated into the curriculum and teach it the way we teach physical health and spiritual and religious studies in schools. So that was what inspired the kids. I feel like the kids will be able to reach a lot more people than I can ordinarily reach. Yes.
Fantastic. And I agree with you that, schools should try to see how they can, fuse this into their curriculum. And I say that, whoever has that opportunity or the link, because it's not enough just talking about it. I can say that I've heard thousands of talks about why this is this, why this is this, but the action is what is missing. Unfortunately, some of the lawmakers that we have that can help hasten this are not doing their part. So I think we need to move from that aspect of, yes, these sessions are good to inform people, like you rightly said, realize, people have to realize, accept, and understand what is happening. So apart from, these talks and these sessions, we need to move to that aspect of implementation. And the best way to catch them young is through the schools. So I want to pose a challenge to you, Ms. O, that after this, beautiful sessions, we need to take it further. And please involve me where there is need. We need to take it further and get it implemented in the schools. We need to cure. The world now is there are some minds that we have to cure, and there are some minds that we have to prevent them from even getting into this era. So we need to work together to ensure that happens. On a final note, what are the steps you think parents and kids can take in implementing or using this wonderful kit? Or how can they use it?
Okay, thank you very much for that question. So the kit is very self-explanatory. Yes, I have used psychological tools in the kit, but they're very well explained in a way that we can all use it. So each of the kits comes with at least 3 items. There's the self-help guide, and that's the most important one. We're supposed to read the self-help guide, understand the usage, and then help our children to go through it together, depending on their age. For the older ones, they can also find their way. And then we should ensure the constant usage. There's also a journal apart from the self-help guide. There's a journal that the children are to fill in daily. And these are like, it's like you have a headache, you have paracetamol, and then you are not taking the paracetamol, but you have it at home. It's not going to work. So the journals are meant to be used. So it's not just about getting the kits, it's about ensuring that it's being used appropriately and daily. For example, there's a gratitude challenge corner in the journals. The children should know that they're not meant to repeat. There was a particular child, the mother screenshot his own, and he was just saying, I'm grateful for life, I'm grateful for every day. I said, no, because they're meant to think. The whole idea behind the gratitude journal is that they're meant to think creatively about the things to be grateful for, and it's part of improving positivity for children and improving perspective for children that have the perspective challenge. So all of these things are the things that we should help the children to do. Then there's a part that they tick off their feelings every day. There's a part again in the self-help guide that explains the different kind of feelings, and the fact that when a child is ticking off a negative feeling every day for about 2 weeks, then you, the parent, you want to ask, what's going on, what's happening? First of all, we need to teach children to stop suppressing feelings. You know, we all grew up to know, how are you? Fine. Even when you're crying like this, fine. They did a documentary one time. People were in the hospitals with sick people, or they were sick themselves, and they were asking them, how are you? And everybody was saying, fine. We need to teach children that when you're not fine, it's okay not to be fine. It's okay to know that you're not fine, but you should be aware, self-awareness. We have to start teaching them from when they're young. I'm not fine. Why are you not fine? This is why I'm not fine. But sometimes they may not even be able to tell, especially the teenagers, and that's fine. So in the teenage part, there's a part that talks about the bliss and blues of the teenage years. So children know that sometimes you're moody and you can't place it, but it's fine, you'll get over it. It's a transition. You know, when they become equipped in such ways, it will help them. So like I said, very easy to use. And of course, there are affirmation cards in it that we can use for children whose love language is the affirmation mode, or even other children. It works for everybody, it works for you and I. If somebody looks at you now and says, oh, you look very beautiful, you're going to smile. But if somebody says, why are you looking like a goat, or why do you look so horrible? Whether you believe it or not, your first reaction is negative and you're frowning your face, that what do you mean? So everybody likes to hear positivity. So basically that's it. It's very easy to use, and it's something that parents that have used it have found very useful.
Interesting. Thank you so much, Ms. O. Thank you so much. It has been, I guess that's where we're going to hang our boots, even if you are not football players. We'll hang our boots in terms of the questions to Ms. O. So this is the screen you wanted to share.
Yes, wow. Please. You may keep talking. I'll just share it. I just want parents to read some of the things that children are saying about us parents. And the truth is, you and I know that some of these things are true.
Yeah. You know, just to mention that in line with this kind of things, I remember that I had an issue growing up personally. I had an issue growing up. There was something I did at the age of 7, and there was a step my mom took. I remember very well that, you know, it wasn't a palatable step to my dad. And, you know, when I grew up, I had a mark of that action. So when I grew up and I asked, what was this mark for? And I was told what it was so grave that I didn't speak to my mom I was at loggerheads with my mom for almost 15 years. You know, it was that grave, you know, and it took the intervention of God and a lot of understanding of life for me to now understand that, okay, she was doing, there are some things parents do in ignorance, not because they are wicked, but because they wanted to, in their own best understanding, pass across a message. And looking at the first line on this you are sharing shows the kind of mindset some of these children have about their parents. And like Zurel said, this they just don't happen. It's a journey. So it started from somewhere. There was a wrong chord that was struck somewhere, and we didn't get the correction of that wrong chord in a good time. So the chord became spoiled and damaged, and So I mean, it's a lot of work, but it's some work that I just pray God keeps helping us. Like there was a participant that mentioned there that she has three lovely girls, and she prayed that God help her. I say a big amen to that, and I pray for all parents that God assist and help us, because it's not easy. Most of us even want to groom our children the way we were brought up, and the living conditions are not the same. We have refused to understand what is going on in their minds, just like you are saying, Ms. O. We have forgotten that every individual, we have our own individual minds, and the way it operates and think and function is different. So for us understanding and identifying those minds, we have failed to understand and identify those minds and work with those minds likewise. So this session couldn't have come at a better time. I'm very grateful that I am a part of it, and I look forward to more that will come. I would like to mention that I thank the organizers very much. I appreciate the speakers, Dr. Afolabi Aroyehun, in-depth analysis, showing us that the journey is long, where we are. We have not even scratched the surface. Zurel came from personal experiences and the clients she interacts with on a daily basis. She gave us detailed steps to trying to understand our kids and love them while we are also loving themselves. And the audience, you have been a fantastic audience, throwing comments, throwing questions. I apologize that I was not able to read all your comments. I apologize that I was not able to take all the questions. As you can see, the session were very impactful and detailed. So we took the ones we could. Please, if I didn't take your question, it's not because I thought that the question was irrelevant, but it was just because of time. I apologize again. At this point, this is where my own duty for this session ends. My name is Babatunde Abdulgani Adigbidin. Some people call me Adishine, meaning a crown that shines. May we all continue to shine in our respective home. Do not forget what Zura said, which stood out for me. She said, our kids are in our school of personal development schools. She also reminded us that we should, as a home or a family, you should have values. What are your family values? Don't forget that counseling and therapy is not a taboo. Like Dr. Aroyehun said, there are 4 different abnormal behaviors. If you identify them, please ask for help. The deviant one, the dangerous one, the dysfunctional one, the distressful one. And I will end with what Ms. O has explained to us. If you have not gotten the kit, please talk to Ms. O to get one. Those of you that already have it, endeavor to use it. Watch cartoon with your children, talk to your children, discuss with them. Some of them are more intelligent than we think. And may God, His infinite mercy, continue to help and guide us. At this point, I say thank you. Nagode, Eshe, Dalu, and this is me saying bye-bye, and I hand over control to the organizers to discuss the coming event. Thank you so much. Babatunde Abigeni signing out.
Wow. That has been a really exciting time with all the parents we have here. We're very grateful to have everyone join us. It's been really good. we had our parenting summit late last year, and it was the same kind of tempo, the same kind of vibe that our parents got after leaving the event. Now we're having this virtual one, and I must say this is supreme. So the year 2020 has been a really, really exceptional year. And for us at Brainy Educare, we believe that every kid, every person must have the right to learn in a very good way, must have the opportunity to learn in a fun way. Despite the challenges that may occur, we are creating situations where our kids can grow, where our kids can develop, where our kids can become better. So we had our virtual Children's Day. We had our virtual Children's Day on the 27th of May. And I must tell you, it was the most fantastic virtual events our children have had. Online learning has posed its own challenges, but we were able to revive a very good situation with.
Alamin, please can you check your voice is echoing, it's really echoing.
I'm aware that there's some kind of echo, so I'm trying to adjust to get rid of that. Now, Brainy Educare is yes, I think it's clear now. Brainy Educare is coming up with the Summer Camp Nigeria, the virtual Summer Camp Nigeria. Summer Camp Nigeria is Nigeria's premier camp where we have children around the whole world come together, share their experiences, learn, grow in a fun way. Remember, it's not about always doing the educational things. Kids need to learn, kids need to grow. So we thought about how can we make 2020 an exceptional year that it has actually posed to be since the beginning. We had the Children's Day on the 27th of May. Now, Summer Camp Nigeria is going virtual. So what's Summer Camp Nigeria? Like I said, it's Nigeria's premier camp where kids around the world get to learn, get to interact, get to grow. So we have 9 days of fun in this virtual summer camp. We also have a kind of situation where we invite people all around the world, important guests, to come and inspire our kids. Now, the big news is that there is a 15% discount for every parent that registers for Summer Camp Nigeria before the end of today. Before the end of today. So that's a discount we are providing parents, every parent that attended this seminar. You can get that discount for the Summer Camp Nigeria before the end of today. Details will be shared in the chat. Thank you all for attending. Now we have another gift. There is a parenting ebook that we're going to be sending out to parents. That's another gift for us. We believe in your ability as a parent to parent children. Children are our future, but the future of our future lies in your hands. So we are counting on you to parent our future the best way. That's why we are going to provide resources. We have a parenting ebook that would help parents to parent their children in a very, very good way, maintain emotional well-being, and ensure that mental health is paid attention. Attention is paid to mental health. So this is a very big chance for us. Another chance for us to manage our children's mental health is to sign them up for Summer Camp 2020. And the theme of this year's Summer Camp is Unlock. We're going to be unlocking our children despite the lockdown. It's time to unlock Nigeria. So we're going to unlock. Thank you very much for attending. It's a pleasure to host you all. Thank you to the host, to the moderator, Mr. Babatunde Adeshine himself. We're very glad to have you here. For early birds, there is a parenting ebook, and for all attendees, there is a parenting ebook. Thank you so much. And don't forget to make use of the opportunity to sign your kids up for Summer Camp Nigeria at a 15% discount. Our kids need to be unlocked, and we're ready to unlock. Thank you all so much for having us.